Good afternoon, colleagues. The Senate Finance Committee is now in session. We have a number of very interesting bills this afternoon, and I'll just run down the list in the order in which they will be heard. We're starting with Senate Bill 556, Senator Young. We'll then go to Senator Casserly, Senate Bill 610, Senator King, Senate Bill 710, Senator Kagan, Senate Bill 579, Senator Carozza, 594, Klossmeyer, 653, Bottle, 704, Feldman, 707, and finally, Feldman, 514. For each of these bills, the sponsoring senator has as much time as he or she needs to lay out your bill and to clarify any questions that might be raised. Following that, the lead proponent is designated by the sponsor, will have 5 minutes, and all other speakers will have 2.5 minutes each. So we'll get started now with Senator Young and Senate Bill 556. You're on, Senator.
Okay. Thank you, Madam Chair, Mr. Vice Chair, members of the committee. I'm here this afternoon for Senate Bill 556, which would extend collective bargaining rights to the teachers, specified non-supervisory educators at the Maryland School for the Deaf. This legislation does not enter teachers and faculty into teachers union or association. It just ensures that these educators have the same right to collective bargaining enjoyed by other public school teachers in Maryland. As I'm sure you all are aware, MSD is a state-run public school that educates deaf and hard of hearing students across the state. Their main campus is in Frederick, and they have one also in Columbia. MSD is from kindergarten through 12th grade. And while other teachers across the state have collective bargaining rights, MSD teachers do not. And this would, the financial note on this just says that the expenses would be minimal and they would just go to reimbursement for collective bargaining expenses. So this would just fill a gap. I think 2 or 3 years ago, I put a bill in which passed. At that time, these teachers didn't even have tenure. They were on 1-year contracts and could be let go at any time. And we've just been trying to establish these teachers with the same rights that every other teacher in the state has. They do require special training for what they do. And we just feel they should enjoy all the same benefits that any other public teacher would have. And that pretty much covers the bill. I'd be glad to take any questions. And
thank you. About how many people in a typical school year make up the faculty at the school?
I'm not sure what their faculty is. It's not a huge school. It's probably less than 100.
Okay. Okay, thank you. We'll go next to your lead proponent, Jacqueline Gures from the AFT Local 4828.
Thank you so much. Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the Finance Committee. I'm Jackie Gears. I'm an IEP coordinator currently at the Columbia campus at the Maryland School for the Deaf, and I'm also president of AFT Local 4828, the Association for Faculty and Deaf at that school. I submitted a written testimony, and several of our members have submitted written testimonies as well in favor of this bill with amendments. We believe this school would align our school with that of other K-12 public institutions to grant us collective bargaining rights. So I've been employed at the Maryland School for the Deaf for almost 14 years, primarily at the Columbia campus, which is in Howard County. I taught elementary age students for 9 years in various grade levels. And then at the end of my 10th year, I was asked to become an IEP coordinator, and I've now been an IEP coordinator for almost 4 years. So our school is very unique. And just to clarify what Senator Young said about employees, we do have, I believe, more so of like upwards of 200, 300 employees, but I could be, I'm happy. Annie Curran, who is the head of our personnel department, she could probably even further clarify that. But he is right. We are a small school, but a unique school in that we serve the entire state of Maryland and many students come to us from many different backgrounds from all over the state, from all the counties. They come to our school and they may be as young as 3 years old, or they might join us later. We have a high school at the Frederick campus. Columbia campus only goes up until 8th grade, so it has a middle school. Every child on our campus is deaf or hard of hearing, but they may also have additional needs or additional disabilities. So every child who is eligible at our school has an IEP as well. So every teacher in the classrooms, all those students, if they have 6, 7, 8 students, they would all have IEPs that the teachers have to track and monitor as well. So I, along with all the other educators, we have to follow the MSDE requirements for state certifications. Many of us are required to have master's degrees to work in the field of special ed or deaf education. So we follow the same requirements for licensing or certification and curriculum set by MSDE as would the public schools. But for whatever reason, our teachers and our non-supervisory faculty do not work under the protections of a collectively bargained union contract. So we're hoping to gain that with this bill.
Yeah,
So
Okay.
I'm very proud of the work that we do. I'm very proud to be an employee of MSD. But
Yeah.
unfortunately, over
Dolores
time,
is chairing, I'm not chairing.
instability
Well,
with,
so, part of our complications right now.
okay. Oh, I'm sorry. You need me to stop?
No, someone else is interfering and is talking. You have to go
Okay.
ahead. I'm not sure how they are doing that, but
Okay.
you please continue.
Okay, I apologize. We have lost a number of high quality educators to other institutions or states because we don't work under any protections, and being state employees, and MSD is a state agency, we have struggled to be competitive, especially with pay, to maintain and recruit high quality educators at our school. We are also hoping with the impending passage of Kerwin, which we do support, that the staff at our school, we're not sure if any of those improvements will be afforded to us because they have to be bargained collectively with the school board, and we don't have a collective bargaining agreement at this time. Okay, so just like every other K through 12 public school in the state, the ability to bargain with our school board over the conditions of our employment is vital to a healthy educational workplace today. And it also hopefully means that we would be eventually placed onto the career ladder and other benefits afforded to public schools with the enactment of Kerwin if it becomes law. So that's my testimony. Thank you so much for your time.
It's very helpful testimony. Are there teachers who have the qualifications that you have in addition at the regular 24 county school systems or not?
Yes, there are many teachers like myself who are highly qualified, state certified, who work at the Maryland School for the Deaf. I don't know the specific numbers, but it is a requirement for employment. And if they don't have it while they're hired, they are required to work on it. But we are, to my understanding, we have to follow the same guidelines as the public school teachers do in order to maintain our certification.
Okay, and about how much, what is the size of the pupil population in Columbia and in Frederick, just roughly?
I want to say We probably have total, maybe a little over 500 students. I would think at Columbia, we might have like 120, 130 students, perhaps. There's more students at the Frederick campus because they have a high school program and we do not. If any, I have other people here testifying. If they feel that my
Okay.
information is incorrect, please correct me.
That's all right. You've
but
done a
it's-
good job.
Thank you.
Okay, thank you very much. Are there any questions for this witness? All right, seeing none, we're going to Deborah Hill next. Are you Deborah Hill? Okay.
She here?
Is Deborah Hill available?
Good afternoon, Madam Chair Kelly and the members of the Senate Finance Committee. My name is Deborah Hill, and I'm a 30-year plus employee at the Columbia campus of the Maryland School for the Deaf. I've worked in various capacities. This year is my 5th year as the elementary department secretary, so to speak, but that's my official title is clerical aide. I used to be a teacher's aide for over 15 years. I used to work as a RCYCP, which is another term for dorm counselor many, many moons ago. I'm currently the vice president for the AFT local 4828 union for the Maryland teacher staff that are working at the Maryland School for the Deaf. And on behalf of the rest of the public school educators who teach at the Maryland State students, including our deaf students, I encourage the, let me go back, I'm sorry, I'm calling for a vote in favor with amendment to Senate Bill 556 to get us the right to be included in collective bargaining rights that each and every public school teacher has in the state of Maryland. We at Maryland School for the Deaf don't have that. You have my written testimony that I have submitted to you, and I'm going to give you a few points, key points that I would like to point out to you. All along the public schools, we have not been receiving the same treatment as those who teach in the Maryland schools in the state of Maryland. We have a completely dedicated staff who invest time, materials, lesson plans to integrate into the classroom and to comply with the curriculum of Frederick County. And now they also have to agree or comply with the curriculum to meet the needs of each and every student in those classes in our school. And it's really very challenging to meet the levels of students in our classes. As many of our county school employees throughout the state of Maryland, we at MSD oftentimes pay from our own pockets because supplies are limited at the school. The employees are given pay that is not on par with the years of experience and years of working at the school. And that impacts us. We lose good and qualified teachers to other local school systems. We can't hold them because we can't give them what they deserve. Now, in addition, our school is placed at an unfair disadvantage when it comes to recruiting potential educators and staff to work at our school because of their lack of rights. Now, I myself am nearing retirement. And for so long, for many, many years, I've been working 2 jobs. My daughter graduated in 2019 from the Maryland School for the Deaf. No, she graduated from College of Social Work, and she now is employed as a teacher's aide at the Columbia campus. And she's an alum of Maryland School for the Deaf. She does not collect unemployment. She's following in my footsteps of maybe getting a second job just to help her to pay for healthcare insurance, to be able to save money. Right now, she has large student loans and debts to worry about. And really, I am hoping that she will have a better experience than mine. With this bill, I am hoping to correct that mistake. This bill will definitely go a long way, if passed, for our school that will then provide critical instructional services to MSDs, deaf and hard of hearing students. We will no longer be treated differently than any other public school in the state of Maryland. And last point, the amendment we propose will include collective bargaining and other non-supervisory staff at the school, expand it to those people, not just the teachers. They do their job in the local county school districts. Those people have unionization rights, and we amend this bill to make them on par with the other public schools. And again, I strongly urge you and encourage you to support 556, Senate Bill 556. Thank you very much.
Thank you. So the other staff that aren't the teachers, would they include like librarians and guidance counselors or social workers?
I'm sorry, I cannot see the interpreter. Can you spotlight the interpreter, please? I can see the interpreter now. Okay.
Okay. Okay. All right. Let's
Okay.
move on. Did you have a question, Senator Benson?
No, thank you.
Okay. All right, then let's move on
Yes,
to,
that's part of the amendment. This is,
okay,
Deborah Hill. Yes, that's part of the amendment. I'm sorry, I couldn't see the interpreter.
okay. All right. What about, let's hear now from Edna Johnston.
Can you pin the interpreter, please, who's talking for me? Okay, I'm requesting 2 additional minutes if possible, because we have a lag time with my signing to the interpreter and the interpreter processing and then having to speak what I have to say.
Okay. We're waiting for Edna Johnston.
Can you spotlight Edna Johnson, please? Good afternoon, Chairwoman Kelly and members of the Finance Committee. My name is Edna Johnston, and I am an ASL instructor at the Maryland School for the Deaf Frederick campus. I'm also a member of AFT Union 4828. It's the association for the teachers. I've submitted my written testimony, and I'll briefly go through some of the salient points today. I would like you to vote favorable with amendment to this Senate bill, which will make our school aligned with other schools in the state of Maryland. It will then give us collective bargaining rights. I'm an alumni of this cherished school, the Maryland School for the Deaf, and I have several relatives in my family who have graduated from the Maryland School for the Deaf yet also. I am a product of both campuses. I went to Columbia and Frederick campuses for my education. I am a certified teacher, and that is all outlined in my PDF submission of my testimony. I taught English literature, writing comprehension, remedial English, comparative languages, and so forth and so on for my first 8 years at the Maryland School for the Deaf. I'm teaching middle school now, but I am actually a high school teacher, but they needed a teacher in middle school to teach literature, and I'm teaching ASL and literature in high school. My co-team worked every single day, often during the summer without pay or very small stipends. We worked on development curriculum because ASL is not a written, does not have a written form. we were revamping the curriculum to make sure that it was given in ASL. As Debbie explained in her testimony, we pay for our own videotaping equipment. ASL's videos are made oftentimes that are old. We have to re-record it into ASL because I'm passionate about the Maryland School for the Deaf and our deaf students as well. Certification. I noticed that Maryland schools, our teachers are overqualified. Even our aides have bachelor's degrees. Our teachers oftentimes have master's degrees or 2 or 3. I have 2 hearing kids and 2 deaf children. Their teachers, the hearing children, their teachers have bachelors. My deaf children have teachers who have master's degrees. They are overqualified. As Jackie and Debbie had explained, our students vary. We can see that from Jackie and Debbie and myself. Jackie speaks for herself, even though she has some hearing loss. Debbie can speak with her own voice some. I do not voice. I use American Sign Language as my mode of communication. We are just a little sampling of our students that we represent in our school. Many of them do not have exposure to American Sign Language at home. Some of them have lip reading skills. Some of them have additional disabilities. Some of them sign only. So we have a lot of diverse instruction going on in our classrooms at the School for the Deaf. Some of them are also called semi-linguals. This is your investment back to your UI, giving us equal treatment, not better than treatment. We're not expecting, I'm now paying back, you invest me with a wonderful education, and now I am paying you back as a teacher. So we're asking you for this investment, for your return on investment for our students. Our students, some of them have special ed, ADD, ADHD, autistic, anxiety, depression, even worse now during the COVID pandemic. Our goal is to meet each child's needs, no matter how diverse they are. And lastly, I would like to close by saying we are asking for equality, not special treatment. All of us teachers work a lot with the teachers' aides. We work with one-on-one aides. We are all working as a team. And I think it's reasonable for us to ask for favorable with amendment report to this bill. And thank you for your time.
Thank you very much. Are there any questions for this witness? Okay, and we're going finally to Ann Curran.
Good afternoon, everyone. First of all, I want to say that the Maryland School for the Deaf administrators are not opposed in principle to this bill at all. We are very proud of our teachers, and what they are telling you is absolutely true. They're not only as qualified as the teachers in the county, they bring even more to the table considering they are special ed teachers and with a specialty in hearing loss. And often with certification, they're at a disadvantage because the system is not set up to make it easy for them. I do have 3 concerns. And partly, I guess it's because I never had an opportunity to speak with Senator Young about the bill. I feel like we absolutely must amend it to include our teacher aides and our dorm staff. Anybody who is on this specialized faculty independent pay plan should be included because, as they've mentioned, I do have teacher aides who are limited in the salary pay plan because they're teacher aides, but they're just as qualified. So, and the dorm staff as well. So they should be included in that. My second concern is that we cannot support an unfunded mandate. So in order to have somebody who could delve into collective bargaining and support everything that needs to be done, the school really does need another position with a PIN and funding. I'm the head of HR. I've got a department of 5. We do payroll, retirement, recruitment, everything from A to Z with 5 people on our team. So it's a little difficult to get everything done and done well. My last point, and this is where I think maybe we need to consider a summer study for this. The Maryland School for the Deaf is a public school, but it is also a state agency. Our funding for our faculty is derived by looking at the negotiated salaries for Frederick County and Howard County. It's reviewed every 3 years, and we update that salary for them. So we are using negotiated salaries already. But because we're a state agency, we cannot grant steps on an annual basis when the governor doesn't put it in his budget. So Ms. Gears is absolutely correct. I've got people who have been here for 25 years and haven't gotten steps in, well, maybe at least half of the time they've been there, depending on the economic situation with the state. And there's nothing I can do about that. It's the way the budget is set up with the governor as a state agency. So it may be time for us to look at possibly revamping the law that created how we come to our faculty pay plan, and not looking at steps as regular state employees get, but looking at stages that are based on years of experience. Even if collective bargaining passes this year, we will not be able to solve the step increases for our faculty. And that's just the bottom line of how the law's been written. So I would very much like to support the opportunity to look at collective bargaining to make sure that we provide the best environment for our teachers and try and hold as many as we can. But we will need to look at another alternative for steps.
Thank you. Ms. Curran, I'm looking at Senator Young's amendment, and it includes dorm counselors and teacher aides. So that's already in there. If we pass the bill with this amendment, we've covered those two that you're concerned about.
Okay, thank you. That was never shared with us, and I tried to find it online and couldn't.
Okay. And thank you so much for your testimony. Are there any questions for this witness? Okay. Are you, Senator Benson, did you want to talk? You need to unmute yourself.
Madam Chair, was not this bill before us last year? Did we have?
Not in this form. I think it's better laid out this time. Got this nice amendment to include the other professional workers who aren't the teachers themselves.
Yeah, I'm just wondering what happened to the last year's bill.
I don't know, but we're going to work hard to try to make sure we get this one through, aren't we?
Okay, thank you. Thank you very much.
Okay.
Madam Chair, I think Senator Benson might be recalling the one we got through before that recognized.
Okay, well, you've done a good job this year, and this is a good amendment that makes it much more comprehensive in terms of who's included. And
Thank you.
We'll commend it to the committee. Thank you.
Thank you.
All right, we're going now to Senator Casserly, Senate Bill 610, lodging establishments, accessible rooms for individuals with disabilities deadlines.
All right.
Senator, you have 5 minutes, well, whatever time you need. And you didn't designate a particular person, but go ahead. You get us started.
Thank you, Madam Chairman and distinguished members of the committee. Last year, I was before this committee on the bill that allowed, they created standards for bed heights in hotel rooms. And I very much appreciate the committee's support, and that bill became law. Since then, because the bill required we worked that bill out with the industry, and I appreciate the industry's cooperation and coming to the standards, as well as the schedule under which they have to roll out these new beds. The industry approached me this year and said, hey, we're getting really hard hit by COVID. We're not leasing our rooms, and we didn't anticipate this at the time we signed up. We would really appreciate another year to work out so that this is not an excessive financial burden. I thought that was a reasonable request, Madam Chairman, and so I'm back before the committee this year simply to extend that deadline to allow the industry additional time in which to make the adjustments that they agreed to that was support of last year's bill. And that's the only changes. And this is solely to allow the industry additional ramp up time in the light of their reduced income due to COVID. And my witness on this, who's I see in the room, is Mr. Frank Boston, who was the advocate for the industry. So that's my.
I remember your brother gave us excellent testimony on this
Yes.
before.
Thank you.
How is he?
He's doing well. Thank you.
Good.
Enjoying
Okay.
retirement.
Thank you. All right, so then you want us to go to Mr. Boston next?
Yep,
Please.
Okay, we'll do that.
yep. Good afternoon, Madam Chair, members of the committee. I'm Frank Boston III. I'm here on behalf of the Maryland Hotel and Lodging Association. And thank you for allowing me to testify this morning. And we thank Senator Castley for understanding. I really have nothing further to add. He explained it well. The bill just simply takes the work of the committee and pushes it, all of the dates out one more year. As you know, one of the hardest hit industries is the hotel industry. And, we are scraping to make ends meet, and some hotels have been closed. You'll hear more from Amy in that regard. But, you have a lot of work. That's all I have to say is it's a bill to extend it 1 year. Thank you, Senator Castley, and just urge a favorable. Thank you.
Thank you very much. Are there any questions of either of these witnesses? Okay, we'll go next to Amy Rohrer from the Maryland Hotel Lodging Association.
Good afternoon, Madam Chair and members of the committee. Thank you for hearing this bill. For the record, my name is Amy Rohrer, here on behalf of the Maryland Hotel Lodging Association in support of Senate Bill 610. I would very much like to thank Senator Castley for sponsoring this bill and being open once again to working with us. We worked very closely with him last year on the bill that passed, and I have to say it was educational for me, and the industry very much knows that accommodations for our guests in wheelchairs and the issue of bed height in those ADA rooms is very important. And I'm proud that at this point, Maryland is taking the lead on it. But as it has been said, and I know you've heard from me before, 2020 was the record for our industry. The average occupancy for the year of 2020 has hotels operating below a level where they're even breaking even. And we're extremely grateful for any relief that we've received, both at the federal level and the state level. We are working very hard to make that relief last as long as possible. It is a lifeline at the moment. So we just very much appreciate the ability to postpone this expense for a year if this bill passes. And so I will wrap up and just thank you for your consideration and respectfully ask for a favorable report.
Okay, well, you're lucky there's no opposition list for your bill, so let's hope that what you're asking for can happen. Are there any questions for this witness? If not, we thank you for your testimony, and that's it.
Thank you, Madam Chairman, committee members.
Yes. Thank you. Yeah, we thank you for your testimony, and thank you. All right, we're going next to Senate Bill 710, Senator King, and state and local government and private employers teleworking. Senator King here.
I'm here. Thank you very much, Madam Chair.
You need to lay out your bill.
Okay,
Your chief proponent will get 5 minutes and everyone else 2.5.
okay, that sounds good. Thank you. Madam Chair and members of the committee, we've learned many things over the course of the past year, and one of the things we have learned is that teleworking works. I think we can all see how well it has worked in our individual offices. I know my staff hasn't missed a beat, and I'm sure it is the same for yours. Teleworking provided government agencies a way to ensure continuance of government, and it offered private employers a way to perform their duties without putting themselves or their families at a risk. Along with the safety factor, we also saw the added benefits of teleworking: less cars on the road, less congestion on our highways, and the correlating reduction in greenhouse gases. Senate Bill 710 takes into account all of these positives and requires state and local government agencies to establish a program allowing employees to telework. The bill also includes intent language that encourages private sector employers to develop and implement telework policies for their businesses, along with intent language for the General Assembly to authorize a tax credit to assist private sector employers in offsetting costs incurred for the development and implementation of a telework policy. The benefits and successes of teleworking are many, and I request a favorable report on Senate Bill 710. And Madam Chair, you will hear from my panel and others. I think there are some amendments that could be offered, and I just want to say that I'm willing to work with amendments. I just want to see us get the best bill out that we can possibly get.
Okay, thank you. Are there any questions of the sponsor? Okay, then we're going to Denise Gilmore, who has 5 minutes. She's from Maryland.
Good afternoon, Madam Chair, Mr. Vice Chair, and members of the committee. My name is Denise Gilmore. I'm a field director with AFSCME Council 3. Across Maryland, we represent 30,000 state and higher education employees. We thank Senator King for introducing this important legislation for our members. We've all experienced how the issue of telework has really amplified this past year. SB 710 makes important improvements to the state's existing telework law, but for our members who were mostly denied the opportunity to telework prior to the pandemic, we'd like to see some additional steps taken to ensure that our members in the state continue to consistently have access to teleworking once the pandemic is over. The only way to make sure that all eligible workers have the option to telework is to place some minimum guidelines that telework programs must follow. We've all experienced now what some of these should be, like clear expectations of the work that is to be done and by when, which equipment will be provided, and what the employer will need to provide, and proper training. We have policies and laws for these areas when employees are in the office. Why wouldn't we do the same when employees work remotely? More Maryland employers are offering telework than ever before. We passed laws so that people can get access to rights and benefits. AFSCME is proposing amendments to SB 710. We include more details on each of these amendments in our written testimony. Our amendments provide clarity to ensure that higher education employees are covered under this bill. They set that telework policies be negotiated. They guarantee that teleworkers are treated the same as non-teleworkers, and that telework agreements can only be terminated for cause. And they set a minimum threshold for what telework policies must include. Finally, they require the state to provide information annually on cost savings incurred through the telework program, and requires the state to report on who is actually participating in the telework program, in addition to the number of employees who are eligible. There are so many benefits to increasing the number of Marylanders who have access to teleworking in the future. There's been a lot documented about the state staffing crisis. The ability to telework is a small incentive that could help recruit and retain more workers. We look forward to continuing to work with Senator King and this committee to pass a fair and equitable telework program here in Maryland, and we're encouraged by the work the House has done so far on the companion bill to SB 710. We have 2 members signed up to testify, Sandy Davis Martinez and Cherish Vic, who will share their experiences with teleworking. We urge a favorable recommendation on SB 710 with amendments. Thank you.
Okay, now let me ask you one thing. You're not saying permit it or make it an available alternative. You want it as a requirement. Do you think there are some workplaces or some particular jobs where it would not be applicable?
Yeah, I think there are certainly jobs that you simply can't do remotely, right? There are jobs that you have to show up. What this bill does is it just requires that there's a policy, right? And I think in some areas the policy may be you can't telework, right? But in other areas where certainly you have work that you can do remotely, we just want to see a policy that's fair and equitable and helps ensure that worker and employer know what the expectations are of that work prior to engaging in telework. That's our main.
Okay, thank you very much.
Yeah.
All right, Senator Hershey has a question for you.
Thank you, Madam Chair. Can you just go over again the part that applies to private employers? Please, Denise.
Sure.
Yeah, thank you.
Sure, I'm happy to do that. And I should say, I think the House has taken some steps maybe to alter this a little bit to ensure there's amendments popping on this, but I think it's the intention is just to ensure that that there's a policy, right? I don't think it actually mandates that private companies actually force workers to telework, but it's just to make sure that there's a policy.
Okay. And then I'm sorry.
It's my intention to not force this on especially private businesses.
Right. Okay. I thank you, Senator. I do know that a number of businesses are talking about this right now as a kind of a broader concept, but some are also talking about how I best put it, maybe readjusting compensation or salaries payment as a result of doing this. And one of the things that have come about is that employees that can telework now can do it from different locations. They might not have to live in more expensive areas. They might go somewhere else. They might be able to avoid commuting costs, tolls, parking, meals away from home, maybe in some cases no longer have to pay for daycare. A lot of different things as the private sector community is looking at this. Has there been any conversation about this from at the statewide level, or as you're looking at state employees? Again, if there ended up being somewhat of a trade-off, sure, we'll let you telecommute. We can feel you can do that, but at the same time, maybe the salary would be reduced as a result of that offset.
Senator Hershey, I can say I am not aware of any, conversations to that aspect, going. One of the things we do request as part of our amendments to the bill is that annually the state, reports on cost savings. We know in several agency budgets that it did appear that there were some significant savings to the state in terms of like office leases or savings for security personnel when you don't have those offices. So we would like to see the state report on what they're saving.
Yeah, I was going to follow up with that next. Have we seen that state agencies have downsized on their office space, have reduced leases already? I mean, has that actually taken place as a result of the teleworking?
Absolutely. I think the Department of Public Safety and Correctional Services is probably the best example of that. They have, definitely in the Division of Community Supervision, Parole and Probation, they've seen, a savings in terms of office leases. I think their headquarters building on Joppa Road, they're looking now to potentially close as a result of not needing to have a full complement of employees in at one time. So, there have been savings on that end. In terms of, what happens then to the employer? One of the things that we found was that, and again, I think this can be fixed with, a better policy, is that, many of our teleworkers did actually incur, some additional costs. Obviously, there are costs to set up a home office. There are costs to running your utilities all day when ordinarily you would have, shut those off when you were, reporting to an office. So, we're very interested in continuing to work with the state to look at exactly, what the cost savings are to the state, what the expenses are to the employee, and how we can make this work in a way that, hopefully no one, we can make some costs offset here as a result of the savings that are happening. So.
Okay, very good. Thank you, Madam Chair. I do think it's important that we look at, maybe cost increases or cost savings on both sides of the ledger here. Again, I'll try to find some more information on what I've heard from the private sector as well on their way of doing this and giving the opportunity, in many cases to telework. But I've heard there have been some trade-offs. So thank you very much.
To the witness, it occurs to me that we probably, if we were trying as a state to implement such a plan, would need to look at how to do supervision and guidance and training for incoming employees, periodic training that we all need in our jobs in order to stay abreast of new parameters and so on. So you guys may want to give some thought to that, because once this good bill passes, then it's got to be implemented. We need to think about all those things.
Completely.
Okay, thank you. Okay, let me go next to Sharice Vick.
Thank you. Thank you, Madam Chair, Mr. Vice Chair, and members of the committee. My name is Cherish Vick, and I'm a proud member of AFSCME Local 112. I work for the Prince George's County Department of Social Services and the Adult Resources Bureau. I'm doing the exact same job during the pandemic I did in previous years. I visit vulnerable adults in their homes, and I do assessments. I then write up the reports and put in case notes. For years, my coworkers and I have been asking to be able to telework. I live in Charles County and commute to Prince George's County, and I was spending a lot of unproductive time sitting in traffic on Route 5, polluting the environment. But me and my coworkers were always told that we couldn't telework. I'm grateful that things changed during the pandemic. DHS supplied me with a laptop and phone. And with the exception of when I go into the field to visit with my clients, I can do everything else remotely. Statewide in DHS, we've been as productive as ever while working remotely, processing over 1 million SNAP applications and continuing to enforce child support orders. There's a real concern that once this pandemic subsides, telework will no longer be offered to us on the front lines. And I'll once again have to go right back to sitting in traffic for multiple hours every day, when I could be using that time to get my work done and spend more time with my son. SB 710, as written, requires the state to report to the General Assembly every year the number of state employees who are eligible to telework. But it does not require the state to report on who is actually participating in the telework program. I would like to see the state track EEO and income data of who actually gets to telework, so that we can continue to provide oversight and make sure that the option to telework a few days a week is extended fairly. There are only positive benefits to having fair telework policies. Please provide a favorable report on SB 710 with amendments. Thank you.
Thank you. Are there any questions of this witness? Okay, thank you. We're going next to Sandy Davis Martinez.
Good afternoon, Madam Chair, Mr. Vice Chair, and members of the committee. My name is Sandy Davis Martinez, and I'm a proud member of AFSCME Local 1803. I'm a revenue specialist in the field of Enforcement Division, in the Controller's Office in Annapolis. On Monday, February 15, the Relief Act became a law. 4 short days after, my co-workers in the Compliance Division processed 98% of the stimulus payments received by Marylanders under this act. All of this was made possible by teleworkers. You, the legislators, and many behind the scenes continue our work remotely and adapting to this virtual world. Some have thrived, others have struggled, but productivity has continued. And for those who benefit from more than working conditions, they experience a quality of life, improvement that reality wasn't such a big deal for their employees to provide after all. But perhaps the greatest benefit of telework realized during this pandemic were the positive impacts to the environment and traffic congestion our state experienced, of course. I speak from experience. I was never allowed to telework until this pandemic hit. And for me, being able to work from home a few days a week, it has been our greatest achievement. Me being immunocompromised person meant that I was less exposed to catching this deadly virus. But what would happen once there is no longer a pandemic to force us to work remotely? My biggest concern right now is that they'll just cancel my telework with no notice or reason. There's no telework agreement in my office. So individual managers right now are receiving no central guidance and are making up things as we go along. I don't know what I would have done if I was in another office where they couldn't let me telework at all. SB 710 gives us a chance to do that with telework. I ask you to please provide a favorable with amendment report on this important legislation. Thank you for listening to me.
And thank you for your testimony. Are there any questions for this witness? Okay, and we're going next to Drew Jabin, Maryland Association of Counties.
Hello, Chair, Vice Chair, members of the committee. For the record, Drew Jabin here on behalf of the Maryland Association of Counties, here in opposition to Senate Bill 710 as written. As always, you have my written testimony. I will keep it very brief. I'd just like to make a couple points. As written, the bill does contain a broad, undefined mandate. And due to the pandemic, counties have already implemented some form of telework at the county's discretion and are already meeting the spirit of the bill. So along the lines of Chair Kelly's question about some jobs that can't be done remotely, we've worked with the sponsor of the House Crossfile and the Appropriations Committee on an amendment slightly altering the language to clarify. And we respectfully request this committee to adopt the same amendment, which we are happy to provide. So while we are here in opposition to Senate Bill 710 as written, we're happy to work with the sponsor and the committee on this in order for MACO to drop its opposition. Thank you.
So it sounds like you really are favorable with an amendment. If the amendment be passed.
Yes.
Okay, and I don't see it in our packet. So if you could send us your amendment, we'd
of course
be happy to consider it. Any questions for this speaker? Okay, Justin Fiore.
Good afternoon, Madam Chair, Mr. Vice Chair, members of the Finance Committee. For the record, my name is Justin Fiore, and I'm here on behalf of the Maryland Municipal League, also in opposition to Senate Bill 710, but maybe favorable with amendment is accurate for us as well, or just something with amendment. The vast majority of our members are already utilizing telework and intend to continue that. We would certainly remove our opposition with the amendment that was adopted this morning by the House Personnel Subcommittee, which provides legal clarity regarding how local governments maximize the number of participating employees. I'm happy to work with the sponsor here and members of this committee to accomplish those goals and answer any questions you may have now. Thank you for the opportunity to testify.
So it sounds like you already have a remedy for the problem that you're concerned about. So let's hope we can get the amendment to everybody and make sure we get it here in the Senate Finance Committee so we can consider the amendment also. Any questions for this witness? Okay, hearing none, that ends the testimony on Senate Bill 710.
Thank you, Madam Chair.
Okay, we're going next to Senate Bill 579, Senator Kagan.
Thank you, Madam Chair.
Facility- Okay, go ahead.
I'm so sorry, go.
No, go ahead.
I love coming and seeing all my friends at the Finance Committee. It's good to be back. For the record, I'm Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville. Let me start by saying that I really didn't want to bring this bill to you. It's a little bit too much of a nanny state for my flavor. Almost exactly 2 years ago, I needed to go to the emergency room. I went to Anne Arundel and I had to use the restroom while I was there. And I washed my hands, and then I was confronted with a blower dryer and no ability to exit the bathroom safely. For the last almost 2 years, I have been having meetings with the Maryland Health Association and the Maryland Department of Health and the Maryland Healthcare Commission and Kaiser Permanente, trying to come up with a reasonable solution that wouldn't require legislation. The best response that I got, other than delay and avoidance, was that MTH suggested that I could file a complaint for every individual bathroom, for every individual stall in every single facility around the state. Now, even if hypothetically I had that kind of time and interest and passion about doing this, I wouldn't be allowed into any of these institutions now in the middle of a pandemic. So that was a ridiculous suggestion. We all know that we just reached the 500,000 death mark with 7,580 deaths in the state of Maryland. We've spent the last year wearing masks, social distancing, and being very mindful about not touching surfaces. And yet in our health institutions, in our hospitals, and in our clinics, we are forced to touch surfaces that we know have been touched by people who are sick. So bathrooms are a petri dish for disease transmission. Flushing the toilet, and you're going to hear, well, I'll tell you about that. Flushing the toilet is going to send COVID particles from fecal matter 3 feet in the air, and it sticks around for up to 90 minutes after flushing. Studies conducted in hospital bathrooms have indicated the presence of MRSA, flesh-eating bacteria, norovirus, E. coli, salmonella, Shigella, streptococcus, and even Ebola. Public restrooms within healthcare facilities do not always have sanitary options for drying hands and exiting the restroom. So this bill would require that there be not blowers, because blowers are terrible. They're good for the environment, but they are terrible for public health. Would be paper towels. We've done it in the Senate. We have the hand waving visual sensor that then gives us a paper towel. And then to exit the bathroom, you could have a choice. You just need it not to be touched, something that you touch, a handle that you touch. So I'm going to show you a PowerPoint in a moment, Tammy, if you would get ready to cue that up, but in a minute, but not yet. But it can be electronic, as we have in many places, and as many stores and restaurants have already done. It can be a foot pull thing, as my gym and many other places have. There can be an arm thing, or you can just use your paper towel or have the option of using your paper towel. But if there's a blower and there is no paper towel, you are stuck standing in front of a door handle with no options of how to get out safely without picking up bacteria. So the primary complaint, and frankly, it seems a little whiny to me, the primary complaint from our healthcare institutions in the opposing testimony was, wow, it's so expensive. It's going to be an undue burden. We're having all these new regulations being foisted upon us during the pandemic. Tammy, if you could bring up the PowerPoint, please, now. I just want to give you guys an idea of the lack of fiscal burden on this. So you can go ahead, the next one, please. So I want to give you guys a sense. These are uber affordable, all of these options. Paper towels, $52.95 each, batteries included. Next. 3 different colors. Look how fun that is. More expensive, but the batteries last for about 4 years. Go ahead. Paper towels inside on this brand are protected from moisture. Go ahead. Touchless foot door openers. Go ahead. So 10 different colors. And you can even put your hospital or clinic's logo on them. It's the step and pull, $29.95. Then there's 2 per package, so it's only $22.50 per package for another option here, yes? Then there's this option for a door pull, 12 or more, $64.75. These are really inexpensive. Go ahead, we're talking about $5 each. Then there are the arm door openers. Again, you keep your hands safe because too many of us just unthinkingly, we take our hands after they've been contaminated, we rub our eyes, and that's how, or touch our face in some way, and that's how disease gets transmitted. Tammy? So this is one, 2 per package, we're talking about $30. Next. There's another option, magnet mounted. You don't even have to hire somebody. Go ahead. We have all gotten into our building every day with a wave to open the door. Obviously, that's more expensive at $200, but using the electronic door entry is what all of us are experiencing, and that's a way that we are staying safe. Tammy? So seriously, the fiscal argument does not carry any weight. We should be able to keep our patients and visitors healthy. Thank you so much, Tammy. If it's possible, Madam Chair, I'd like to switch the order of 2 of my witnesses, let the primary witness go second, if that's okay. If it's not okay, that's fine too. With is Daniel Day. He is a microbiologist. For as much social media as I do, I'm not on TikTok, but he has over 1 million followers. I would love for him, this microbiologist, to give us the overview of the problem and the extent of the problem. So if you could give him as the 2.5 minutes, but go first. He's at the micro guy on TikTok with over 1 million followers. And so he's going to put this in context. I hope he's in the room. Followed by Allison Canterbury, a nurse in the emergency department at MedStar Union Memorial, followed by another one of my wonderful interns, Melanie Ezrin, who's been with me for 2 years actually, as she's a student at University of Delaware. So I'm gonna wrap up in a minute, but some of the testimony from those in opposition, from the Hospital Association and others, we were trying to figure out how to do enforcement because we do not want to send inspectors around the state looking at bathrooms in every healthcare institutions. So what we came up with is the idea that when you are applying for a CON, a certificate of need for any expansion or something, that you basically have to say, yep, we've done this. If the committee likes this idea, likes any other enforcement idea, it's in your domain and you can decide. That was what we thought was modest. We realized that that would not affect every hospital and every clinic. That was a modest idea. There was one testimony that said, oh, but what if it's a single stall or a multi-stall? It's a bathroom that is used by the public and by public who are sick in hospitals and clinic. So it doesn't matter if it's one stall or multiple stall. One other testimony talked about the burden and the expense of electronic door openers. As you saw, it was about $200. I don't think that's too much, but to be clear, we do not mandate electronic. The foot, the pull and go, the arm, there are lots of other options. And I am totally okay if you all believe that just paper towel dispensers and let people have the choice there, that is fine. So to wrap up, Madam Chair, we tried to collaborate on a solution. I did not want to bring this bill Our hospitals and clinics should be focused on not just healing our constituents after they get sick, but preventing them from getting sick. Our public health should always be our top priority. It's an affordable solution. I just can't stomach the complaints about a few dollars to save lives and save health. We have the effective date proposed is January 1 of 2023. Dear God, hopefully we are way past the pandemic then. I think it should be done this week, but we gave them lots of time to do this. And because we pun in EHE, I am going to close with the pun, Madam Chair, to tell you that I believe this is not a crappy bill. And I hope the committee does not stall for time and flush this bill away. With that, I urge a favorable report, and I am very eager to hear from my wonderful witnesses and take any questions. Thank you for your attention.
Thank you. Are there any questions of the sponsor? Okay, if not, then we're going to Daniel Day next, and you have 2.5 minutes.
He's not in the meeting. You have to go to.
Oh, he's not in the meeting yet. We'll go to Allison Canterbury. And you have 5 minutes.
All right. So Chair Kelly, Vice Chair Feldman, and Senate Finance Committee, I'm Allison Canterbury. I'm an emergency department nurse at MedStar Union Memorial Hospital in the city of Baltimore. I'm here in support of Bill SB 579, which would require all public restrooms in hospitals, clinics, and other healthcare facilities to provide touchless options for receiving paper towels and exiting the restroom. As an emergency department nurse, I see a wide variety of patients on any given shift. If any patient does not require a catheter, handheld urinal, or bedside commode in their room, they must make use of the public restrooms that are available in the department. This means that any number of patients frequent these restrooms any given day, as well as any visitors that accompany them. Union Memorial is the Curtis National Hand Trauma Center. Throughout a shift, many patients come in actively bleeding or covered in dried blood, and a hand trauma will likely not prevent them from making their way to the restroom, thus spreading blood drops, dried blood particles on handles and other touch points. Likewise, if a patient comes in with abdominal pain, though fairly debilitating, this is also not preventing an individual from using the public restroom. A vomiting patient that has used the towels and sanitizers provided in their patient rooms may still have bacteria on their hands. As they touch common places within the restroom, they could be leaving behind a plethora of microorganisms for the next person to pick up. Especially in the wake of the coronavirus pandemic, it is imperative that we take every step possible to improve public confidence in sanitization efforts. The reality is that these individuals are too afraid of COVID to see their doctor and be treated/maintained outpatient. Since the start of the COVID crisis, our emergency department has seen a steep increase in congestive heart failure patients that have waited until the last possible moment to seek help due to their fear of contracting the deadly virus. These patients on a normal day and age would seek care from the primary care doctors or present to the emergency room at the initial signs of worsening symptoms, such as fatigue, swelling, or mild shortness of breath. But since they prolong their presentation due to fear, their outcomes are less positive and require more aggressive treatments. These patients may present in acute distress, require BiPAP, CPAP, or more aggressive treatments such as intubation, then requiring a prolonged hospital stay. What if we could eliminate this fear for our patients? What if we, as the leaders of this community, could take a step forward in slowing the spread of viruses, bacteria, and fungi on high-touch surfaces such as bathroom door handles? The only way to move forward is to take precautionary measures that will increase confidence in disease mitigation. For providing a more hygienic, hands-free options in public restrooms, this legislation will ease the fears of many Marylanders. I urge a favorable report of SB 579. Thank you for your time. I am available to answer questions after the rest of the testimony.
Thank you. Do you have any questions for this witness? Okay, thank you very much. Okay, we're going next to Melanie Ezrin.
Honorable Chair Kelly and members of the Senate Finance Committee, my name is Melanie Ezrin and I am an intern for Senator Kagan testifying in support of SB 579. COVID-19 has made us all more aware of our hygiene. Our daily routines now include frequent hand washing and usage of hand sanitizer, but as much as we try to stay safe, some situations are unavoidable, including using a public restroom. Senator Kagan's SB 579 implements a simple and inexpensive fix to a hygiene problem in our healthcare facilities. As we all likely know by now, COVID-19 can remain on surfaces from a few hours to a few days, potentially spreading as a result. This isn't a new issue. COVID-19 isn't the only disease that can spread by persisting on surfaces. The flu, to name one, also spreads this way. Healthcare facilities are filled with sick people who leave a trail of germs behind them, including inside the public restrooms they use. Requiring hands-free paper towel dispensers and touchless exit mechanisms in public restrooms in our healthcare facilities essentially removes a mode of disease transmission. At this point in the pandemic, we have all had to make many changes to adapt to our new normal. I attend the University of Delaware. To make our campus safer, the school has implemented touchless hand sanitizer stations, contact-free pickup for dining locations, and increased the frequency that they clean campus spaces. And as new information has arisen, the school has and continues to make new changes to protect the campus community. The state of Maryland must also continue to adapt as we learn more about COVID-19. Although frequent sanitization of surfaces is key to reducing the spread of COVID-19 and other diseases, it isn't enough in this situation. We must act now to protect ourselves and those around us. I urge a favorable report on SB 579. Thank you.
Thank you. Any questions for this witness? Okay, you did a great job.
Madam Chair, Daniel Day is
Daniel
elected.
Day is next. Mr. Day or Dr. Day, you have 2.5 minutes and you're on.
Awesome. All right, first off, can y'all see me? Let me see, start video. There we go. All right.
Okay.
Awesome. First off, it is a privilege to be speaking with y'all today. My name is Daniel Day, also known as the Micro Guy on all social media platforms, including TikTok and Instagram. My job daily entails me working in a microbiology lab, assisting Dr. Deborah Henson in the lab and tutoring. But initially, I accumulated such a large following of 1 million followers by showing people how contaminated daily objects or items are. Recently, I did a video showing everybody how contaminated public restrooms are. But the thing is, I want to stress the fact that although in these restrooms and in the videos that I do, it's likely there are some normal bacteria. In fact, most of the bacteria are likely normal flora is what we would call it. But the thing is when these normal flora bacteria, let's say from our skin or from or even from the water, when these normal bacteria that are normal in the water make its way that's not so normal, like our eyes or our mouth or through a cut, then that bacteria is in a place that it's not supposed to be. And when it's in a place it's not supposed to be, this is whenever infection starts. In particular, I can name a few. But these infections can include stuff like pneumonia, MRSA, and Pseudomonas infections. Now, these are infections caused by bacteria. Specifically, one bacteria that I would like to hit on is MRSA. The reason I want to hit on MRSA, it stands for methicillin-resistant Staphylococcus aureus. This is a bacteria that is resistant to the methicillin antibiotic. Now, when this is actually a bacteria that is probably very common in hospital setting. For example, in the hospital setting, usually this is a skin infection. This can occur anywhere, but 2 years ago, somebody named Joe Gilchrist had acquired a MRSA infection from a friend's beauty blender product. Her friend had a skin infection on her face, and that infection is so-called to be MRSA. Now, this was on her face, but this can, like I said, it can also be on your hands. And it's likely what happened to Joe Gilchrist is whenever she used her friend's beauty blender, her friend had a skin infection, and now the MRSA is on the beauty blender. She touched it and applied it to her face. Unfortunately, Joe Gilchrist had a cut on her face that made its way into her body, going to her vertebrae. And when it got to her vertebrae, it left her paralyzed from the waist down. And this is an article that you can find online. And the reason, although the beauty blenders are not the same as a paper towel dispenser or a doorknob, what I'm trying to stress is the fact that it doesn't just have to be a beauty blender. It can be anything. As long as somebody that is infected touches something like a doorknob or a paper towel handle, and these bacteria make its way into a place that it's not supposed to be, this can lead to serious implications. Another bacteria that I'd like to discuss that's very common in bathrooms is Pseudomonas aeruginosa. This is a bacteria that commonly lives in water, specifically water faucets. Now, although the implications are not as serious as what happened to Joe Gilchrist, it can definitely lead to rather annoying implications, such as conjunctivitis. When Pseudomonas makes its way into the eye, yeah, this can lead to some inflammation of the eye, which can get serious over time if left untreated. And this is directly from faucet water. Another thing, and if we're not, and this is like
Dr. Day,
yeah.
before you run out of time, could you just speak to blowers, please, rather than paper towels?
I'm sorry.
Get to that. Blowers, hand blowers, if you can just speak to that.
Yeah, absolutely. Yeah, I would love to. So hand blowers, I would not recommend actually. With hand blowers, they actually suck in bacteria from the bathroom and spit it right back onto your hands. And there's actually a Harvard study on this, and they were able to show that hand blowers are actually worse than paper towel dispensers. So definitely don't recommend it. It's just as bad as touching doorknobs, if not worse, because these bacteria are just harboring inside there.
Okay.
And other than that, pneumonia is another bacteria that is very common that can be on these objects.
Okay. You're running out of time.
All right. Well, that's all I have for y'all.
Okay. Thank you so much.
Yes, absolutely.
The final witness for oral testimony is Brian Frazee, Maryland Hospital Association.
Sure. Good afternoon, Madam Chair and members of the committee. For the record, my name is Brian Frazee, and I'm here on behalf of the Maryland Hospital Association in opposition of Senate Bill 579, which would require every healthcare facility's restroom to have a hands-free disposable towel dispenser and a device that allows someone to exit the restroom without touching the door handle. We would also be required to report to the Maryland Department of Health on the status of our restrooms, including an explanation of why any restroom has not yet met the bill's requirements. I first want to thank Senator Kagan for the conversations that she and I and others have had on this issue. The top priority of our hospitals is to ensure that all of our facilities are hygienic, and that has never been more important than right now during this pandemic. There are numerous existing federal and state requirements that I noted in my written testimony on the issue of the plan, design, and construction of hospital facilities, and those include provisions related specifically to hygiene. And there are also specific requirements relating to hand washing stations and bathrooms, and all of that is overseen by the Office of Healthcare Quality. So while we appreciate the concerns raised by the bill sponsor, we do not believe this legislation is necessary given the already stringent requirements on hygiene in our facilities. And with that, we would respectfully request an unfavorable report on Senate Bill 579.
Thanks for your testimony. Let me ask you, what is a typical example of a low cost, available, and recommended or already in use modality in your restrooms in the hospitals in Maryland? You know, to deal with the problem of people completing their business and getting out without picking up unnecessary microbes.
Sure. Is that a question for me, Madam Chair?
Yes. I just wanted to.
Sure. Thank you for that question. I'm certainly not an expert in what our members' hospitals have in their bathrooms in terms of, paper towel dispensers and kind of what's a low cost option. But what I can tell you is that it is a top priority for them to have hygienic conditions in all places of the hospital. And like I said, there are existing requirements, including specific to bathrooms. And I actually have right here in front of me around hand washing stations. We're required to include a hand drying device that is touchless and liquid or foam soap dispensers as part of federal requirements that, again, are overseen by the Office of the Healthcare Quality. I'll also note that we also, in many cases, have hand sanitizer stations right outside of restrooms and other places within a hospital settings, because again, and this is never more important than right now, we have to maintain hygienic conditions in a healthcare setting like a hospital.
So the idea of the sanitizer, you exit the bathroom, but then you sanitize your hands once you've exited out in the hallway or something. Is that what you're talking about?
That is available in hand washing stations, and hand sanitizer stations are available outside of restrooms in every hospital in Maryland.
Okay. This is our last witness, but I'd just like the sponsor to know that among the additional unfavorables were HFAM and lifespan. So they're dealing with the elderly. A population has been hit really hard by the COVID situation. I guess most of their members aren't maybe on ambulatory, but the people who come to visit them are, and might visit the restroom and then take whatever back to the
Totally right.
Okay.
And to just one more
Well,
thing.
you know what, Madam Chair, I got a really long list and I
Fine.
gotta go off. You can send us anything else you got. Thanks a lot.
Thank you all. Take care.
Okay.
Bye.
All right, we're going now to Senate Bill 594, Senator Carrozza. Labor and Employment, Maryland Healthy Working Families Act verification. And Senator, I see you there. Okay.
Thank you, Madam Chair.
This is bill, and your lead proponent will have 5 minutes.
Thank you very much, Madam Chair. Record, this is Senator Mary Beth Carrozza, proud to represent Worcester, Wycomico, and Somerset counties. And thank you, Madam Chair and Vice Chair, and the various esteemed members of the Senate Finance Committee for this opportunity to present and request your support for Senate Bill 594. It's a very simple bill that allows employers to require verification of the appropriate use of paid sick leave by seasonal employees during the 107th and 120th day of employment. That's all this bill does. It does not open up the entire paid sick leave law. Like the agricultural exemption to the minimum wage bill that I presented to this committee last week, Senate Bill 594 is a result of our bipartisan work together on the Senate Small Business Work Group. And during our meetings, I consistently shared the challenges of seasonal employers who, under the current seasonal exemption of 106 days, the challenges that they're facing, and why the 120 days is a truer reflection of the real time frame of the season, because that would include the shoulder season and the time needed to train workers before the season starts. When the original Maryland Healthy Working Families Act passed back in 2018, I, along with other members representing seasonal employers, we offered amendments to extend the seasonal exemption period from the 106 to 120 days, again, to try to reflect the true season, true seasonal employment. And although our amendments were not approved at that time, we were advised by the leadership that it was not uncommon for minor revisions to be made after a major law had been in effect for a couple years, and that bringing the issue back to your committee would be appropriate. And since the passage of the paid sick leave law, the current seasonal exemption to the sick leave law continues to be challenging to our seasonal employers. As a result, I again brought this issue back to the bipartisan Senate Small Business Work Group and appreciated working with the work group members and senior staff on the Senate to craft this verification bill before you today. I took to heart the feedback I received from this committee in the past, and we are not proposing to change the time frame from 106 to 120 days. What this bill does, it authorizes a seasonal employer to require verification that earned sick and safe leave is used appropriately by an employee, a seasonal employee, when the leave is used during the period between 107 and 120 calendar days, only if the employer provided written notice about the verification requirement at the time the employee was hired. Chair Kelly and members of the Senate Finance Committee, I can personally attest that our seasonal small business operators need this relief, especially during the COVID-19 epidemic. And I want to thank all the seasonal operators who have been sharing information and working with us on the impact of the paid sick leave law on their businesses. It is worth noting that Senate Bill 594 has the strong support of the Maryland Restaurant Association, the Greater Ocean City and Salisbury Chambers of Commerce, the Garrett County Chamber of Commerce, the Ocean City Hotel Motel Restaurant Association, and the National Federation of Independent Businesses. I'm really proud of our work together on this bipartisan Senate Small Business Work Group to craft something that's very narrow to address this very specific concern of seasonal employers between this period of 107 and 120 days. And I would ask for a favorable report of Senate Bill 594, and proud to turn over my witnesses to present the rest of the story, Madam Chair.
Okay, I do have a couple of questions. How must this verification be demonstrated? I mean, suppose the person got a positive COVID test, and so they stayed in to go through the hours or day, a couple of days of quarantine to be sure if they're negative or they're positive. And when you mentioned that the Maryland Restaurant Association is one of your supporters for the bill, you wouldn't want them to come in and contaminate everybody else. So how would the verification be demonstrated?
No, Madam Chair, our employers want to make sure that the employees take the appropriate leave, and that leave, obviously would be granted. I think this is a situation where, without that lack of communication, we just want to prevent situations that we've had where certain seasonal employees realize when they hit 106 days that they can take that leave. And all we're trying to do is, if they take that leave, just ask for verification that it's being used appropriately just during that 107 and 120 days.
Okay, you made that part clear, but I'm trying to understand what would be acceptable verification.
Well, that we may need to work out that detail, but to me, communication would be key. I mean, if somebody received a COVID-19 test result, obviously they're receiving it by text, and I would assume they would communicate that to the employer. That would be more than appropriate.
Well, when you say verification, that's proof. I would suggest that you and the team you got some good co-sponsors on here also, that you kind of figure that out. I worry about if you'll get to the floor and have a problem when you don't indicate what it is the person has to do to meet test the verification.
Madam Chair, thank you for that. As you know, both Senators Hershey and Reedy on your committee have co-sponsored the bill. I would welcome the guidance from your committee, and just trying to reiterate that we are trying to keep this very narrowly focused, and and obviously our employers support their employees and want to grant them the appropriate leave. We're just trying to cut out any possible abuse.
One other thing was your delayed implementation because you're concerned about those days when they become eligible to take the leave. If you really care, you don't want to be ripped off at any time, do you?
Well, we were
why would you only limit it? I mean, you either want verification, and if you make it something that's demonstrable and easy to demonstrate, why wait until then?
Well, Madam Chair, the seasonal exemption in the law is 106 days. And we have made the case that our shoulder season really takes us to 120. So we consider seasonal employment, which is what this would cover, up to 120 days. So we are really just trying to cover that 107 to 120, that time period that takes them up to, you know, to what we consider the seasonal employment.
Okay, all right, thank you. Okay, we're going now to your lead person, who is Melvin Thompson of the Restaurant Association of Maryland.
Thank you, Madam Chair, committee members. I'm Melvin Thompson, testifying on behalf of the Restaurant Association of Maryland, and we strongly support this legislation because it will help to guard against the abuse of the sick and safe leave law by seasonal employees near the end of their employment period. And just as a reminder, under the current law, an employer may require verification that sick and safe leave was used appropriately only if the employee uses such leave for more than 2 consecutive shifts. Also under the law, an employer may prohibit an employee from using accrued leave during the first 106 days of employment. The law also allows an employer to require verification that leave was used appropriately for any amount of leave that's used between the first 107 and 120 days of employment, only if the employee agreed to provide such verification at the time of hire. And the law was written this way in an attempt to help prevent seasonal workers from taking advantage of the law by taking paid days off near the end of the season. The problem we're seeing with the way the law is currently written is that seasonal workers who intend to take advantage of it near the end of the season are not required to agree to provide verification for such leave taken during this period at the time of hire. And this causes scheduling problems and increases labor costs for seasonal employers in the hospitality industry, especially because they are often forced to pay for the missed shift in addition to the shift of the replacement worker. All this legislation would do is allow an employer to require verification for sick and safe leave that's used during 107 and 120 days of employment if the employer provided written notification about this requirement at the time of hire. This allows the employer to require such as an employment policy. If the employee then fails or refuses to provide such verification, an employer may deny the use of such leave. And during the debate of the sick and safe leave legislation, some lawmakers said that we could always revisit issues that become problems after the law was enacted. And this has been a problem for seasonal employers in Ocean City, in Western Maryland, and in other parts of the state. And we believe that this is a very simple revision to the law that will allow seasonal employers to establish such a requirement, if they so choose, to prevent abuse of the law and to ensure that such leave used during this period is for purposes intended. And I think we have today some other witnesses who will elaborate more on the problem we are trying to fix through this bill, but I will be happy to help answer any questions. Thank you very much for your time, and thank you to the sponsor for bringing this bill forward.
Sure. Let me ask you, what would satisfy you as verification?
Under the current law, Madam Chair, the type or method of verification is not specified. And I think most employers will allow, in the example that you cited, an employee to show them some documentation that they did have an appointment for a test, or if they are sick, they could tell the employer they were sick. I don't think the employer is really going to be questioning the format or the type of verification. I think the employer just wants to know that the leave was used appropriately, and the employee at the end of the season, in the case that we're talking about with seasonal workers, aren't just using that time because they feel that they've earned it and they want to use it up because they have it before the end of the season. That's what we're really trying to do.
Do you find a pattern that your seasonal employees are less honest generally than your full-time regular employees?
I wouldn't say that, and I will allow those who are testifying today from the Ocean City area. I think we have a restaurant operator who will be testifying. I wouldn't say that. I think what we're seeing here is that employees believe that they have accrued this time and they want to use that at the end of the season because they're going to be paid for it. And that's what's causing the scheduling problems for employers who are employing seasonal workers. And that's what this bill is attempting to fix.
And so you're projecting onto all seasonal workers that are in your industry, the idea that they somehow are dishonest and they'll wait till they get to that last little period of time when it's more advantageous to be ill and pretend to be ill.
We are not saying, Madam Chair, that all the seasonal employees do this, but we are seeing this as a pattern. And because it is a pattern, after the sick leave law took effect, we're seeing it more often than we did before the law.
Let me ask you just
that's
this.
what we're trying to address.
How are you verifying that they're lying to you now? Because you need something to show what verification tests will consist of, what is satisfactory. It would be hard for all of us who don't understand the problem you're trying to deal with to say, okay, for this subset of your employees during this period of time, if they don't verify and verification doesn't get defined in the bill, and then what is the penalty? That they don't get?
Madam Chair, can I offer just a little bit from the negotiations that we talked about in 2017?
I'm going to come to
Okay.
you. We're going to give you a time, but I just want to finish with this witness.
All right.
Yeah, Madam Chair, as the law is currently written, it does not specify what verification means. That is up to the discretion of the employer, and that varies by employer. And so I can't give you what most employers are doing, but you can certainly ask the restaurant operator who will be testifying soon what they require in their specific operation. But there is no definition, and we are not proposing one. But if that's something that you believe that we need to address, we'll be happy to have those discussions.
I think it would be helpful for you guys to get together and to figure out in the real world what verification would be acceptable to you. I mean, you don't want to penalize people when they don't know really what you mean by verification and
Good question.
It is, and you don't want to be taken advantage of, and I can understand that. I won't go on with it, but that would be a concern for me. I think the bill is kind of loose. Okay.
Madam Chair.
Yes.
Can I just?
Yes.
Yeah, back in 2000.
Our plan right now is you can ask a question of this witness because we're dealing with the witnesses and
Okay, well then I'll ask it to Melvin because he was involved in the conversations in 2017 when we came up with the bill.
Mm-hmm.
And I'm sure he remembers that we intentionally left this a little bit vague because we didn't want to specify exactly how verification was provided from the employee. In fact, people will remember, this came from the proponents of the bill that they didn't want to be a very specific manner in which this had to occur, the verification. And the business community of which Melvin was a part ended up agreeing that if it was a little bit vague, then employees had a very different way, but they just wanted that notification that, again, as you were saying, it's not that seasonal workers are dishonest, but as Melvin mentioned, at the end of the time when a seasonal worker knows that the job is about to be done, that they will not be working anymore, the thought was that they feel that they have earned this sick leave and wanted to take advantage of what they had earned. And the business community came back and said, we just don't want to make sure, we want to make sure that they don't all take advantage of it at the same time when we have these scheduling issues. So it wasn't about being dishonest, but it was about them believing that they had earned something, they wanted to use it, and this was just protecting the businesses from all employees using it at the same time. Right, Melvin?
That is correct.
Thank you.
Okay.
Sir.
All right. I hear you. Let's go to the next person. Nicole Christian, Garrett County Chamber of Commerce.
Thank you, Madam Chair and committee members. Nicole Christian, President and CEO of the Garrett County Chamber of Commerce. I'm here on behalf of our 600 members in support of 594. And I think that Senator Carozza and Melvin really did a great job of laying out the bill and the narrow focus. And so I would just say, unfortunately, where we are seeing the abuse, it is with the seasonal employees. And usually that's because your full-time permanent employees don't want to squander that leave. They need that leave in case they do get sick or they have an issue or they have a dependent that is sick. So it's a little bit of a different loyalty that you have from, the seasonal versus your permanent full-time. And it is because they have already accrued or acquired that leave. They believe it's owed to them and they do take it. So it's not that they're more dishonest. It's just a different mindset than you normally see with your permanent full-time employees. And for us here in Garrett County, we do see it happening now that it's been in effect a couple of years. We see it happening quite frequently as we're getting into the dog days of summer and around Labor Day. Some of these, especially the college students, before they go back to school, they're like, oh, I just want to take a day off. As an employer, and from what my employers here have said, a doctor's note in the case of the pandemic of COVID-19, if you have an employee who's tested positive for COVID-19, they must tell their employer. That's part of the contact tracing program. So I believe that there are ways to verify. And again, we're not trying to hold anybody hostage. We're not trying to prohibit the use of sick and safe leave for the reasons that the law was intended. We're not trying to infringe on the employee's rights, but we do need some form of verification to try to prevent this abuse. And it is that small time frame where we see it occur the most. So I don't want to take up any more of your time because I feel it's all been explained and discussed, but Garrett County is very dependent on tourism, as you know, and a lot of our employers, during that peak season, they are dependent on these employees. So, hopefully they can, if we put this program, this verification into place, we could eliminate that abuse. So I would ask for a favorable report on 594.
Madam
Thank
Chair,
you.
can I ask one
Are there any
question?
questions? Yes, Senator
Madam
Feldman.
Chair. Yeah, maybe for Ms. Christian. Just because I agree that Senator Hershey was accurate about why we left it kind of vague, but I'm just trying to think, and maybe you're a good person or the Ocean City folks, just as a pure practical matter, right? You're talking about seasonal. If somebody's at home sick, okay, and they weren't sick enough to go to a doctor, I'm just asking real practical question. If somebody says that they were sick in bed and you said, prove it, and they say, well, I can't prove it. I was sick all day in bed. So you have a dispute about whether they quote, how is a practical matter, do you resolve a disagreement about whether, they were really sick? They didn't verify because they didn't go to a doctor to get a doctor's. They just stayed in bed all day. I'm just asking again, in that scenario where the seasonal workers, I'm not sure how you solve that. Like, I don't think putting a quote verification, I'm not sure if putting a quote verification requirement in for that situation that we're talking about, it seems sort of unresolvable. It's like, well, I was sick. Well, prove you were sick. How does this get resolved?
Well, I would submit to you that because I've dealt with a situation with an employee, a permanent employee I had who was abusing sick time. And we did have to say, you will have to provide.
We're talking about the seasonal. We're back. You're in, getting close to going back to your example. And, you got 3 days left before you go back to school. And somebody calls in and says, I'm sick. And let's say they are legitimately sick, not sick enough to go to a doctor. So how does this resolve that problem?
Well, and that's what I was actually explaining, that because I've had experience with the issue, that if you have told them ahead of time, if you've told your seasonal employees ahead of time, we're going to require verification if you use SSL between 107 and 120 days. So if you tell them that ahead of time, and then if they truly are sick, I hear what you're saying about maybe they weren't sick enough to go to a
Most
doctor.
people don't
but-
rush to the doctor if they're out a day or two. You know, you're not rushing to a doctor's office, particularly today. I'm not rushing to any doctor's office right now unless I'm pretty darn sick, but I'm sick enough I don't want to come into the job. I just want to put that out there. I'm just trying to figure out, like, I clearly understand the intent and what we're trying to achieve here and the abuse. I'm just trying to think in the real world, my hypothetical, I'm not sure that, it's not clear that this solves that problem if somebody really wants to, quote, abuse the situation. But I want to just put that out there for some consumption. Thank you.
Senator Feldman, could I?
Wait a minute, but we can't go back. We got to move forward, Madam Sponsor. And I'm sure there are members here willing to work with you on anything when we get all done. All right, we need to go to Ryan James.
Good afternoon. Thank you, Madam Chair and committee members. My name is Ryan James. I'm the chef and owner of Mother's Cantina Restaurants and a representative of the Chamber of Commerce in beautiful Ocean City, Maryland. I strongly support SB 594. It's my duty to give employees time off to recover from sickness, and I'm happy to provide that time. But I need to know that they are being treated and healthy enough to return to work. And if an employee returns to work without being treated, they could be putting their coworkers and customers at risk for sickness. If an employee is working with an untreated illness, they could be putting themselves at risk as well. Requiring treatment verification forces employees to care for themselves, and I support that. Senate Bill 594 helps me protect my staff, my customers, and the wellness of the whole team. Thank you for hearing my testimony today.
You just said something that was really telling, and it's helpful. You said treatment verification. Nobody had said treatment verification. They said verification. And that's two different entities almost. Okay, well, we'll have to figure out where they lead. So in your case, in Ocean City, you would want the person to show that they in fact have seen some kind of a medical provider and who has provided them with something.
Yes, ma'am.
And I'm not sure that what anybody else said suggested that they necessarily needed to. That's why I kept asking, what is verification? Okay. Senator Augustine.
Thank you, Madam Chair. I'm just wondering, this has been different. There's something different that was said by Mr. James, which is good. I wanted to know, since he is a business owner, how much this has actually cost him, the way that the law is right now.
Thank you for your question, Senator Augustine. I would say that this, the way that the bill is written right now, could potentially cost me a lot of money. In my particular case, towards the end of the summer, between the 107th and 120th day, we have a lot of seasonal workers that are they're on their last week or last 2 weeks of work. However, the tourists, they haven't stopped coming. It's still very, very busy. So we already have an issue of all of our seasonal staff leaving to go back to college, but the tourists are still coming in full force. So we have a difficult time at the end of August and the beginning of September, staffing the restaurant as it is. So now if we have an issue where somebody could potentially capitalize or exploit paid sick leave, that's going to compound the issue of staffing that we already have in our small business and create a lot more headaches for us.
Okay, so I appreciate that, but it's the law right now. So I'm asking you, and I wanted to ask the other folks, because a lot of times, folks, you're a business person, right? As are the other people. You would actually come in here with the amount that it actually cost you, because it's your business. You would know how much the current law cost you. And really, I was just going to ask the other folks the same thing, because I read the testimony and it's all anecdotal, but you guys are in business. How much is it costing you?
I can put some numbers to it. I know what I pay my staff. So let's say the biggest problem we have where this would hurt us the most in my business, in the restaurant business, would be with a line cook. Somebody that's making tacos in my business, working in the carry out expediting area, we pay for experienced employees, we pay $15 an hour. So let's say we have an 8-hour shift. So that's $130. Now we have to pay that 8-hour shift, $130. Then we have to bring somebody else in to do that $15 an hour shift. That's probably going to have them go into overtime in order to cover that shift because they were already on a full-time schedule. So now we're paying, excuse me, I'm going to do some calculator math here. So we have 15 an hour plus time and a half. So we're at 15 plus another $7.50. So we're at $22.50. So let's call it just for easy. I turned my phone off so I wouldn't get any calls during testimony. So let's call that an extra $200. So it cost me $200 to pay that person an overtime rate. So now I'm out the $130 for the person for the paid sick leave. And then I have the differential between the normal $130 and the $200. So that's another $70. So now we're looking at a total of $230 per person per day that person couldn't come to work because they were sick.
Okay. So I appreciate the speculative nature of what you're saying. That's very different than what it actually has cost you. I appreciate your answer, but I'm just saying, like, there's a lot of speculation versus, hey, this thing cost me this amount of money 2 years ago. I mean, this last year is just obviously a year that's very different, and everybody understands how difficult it was. But that would be, I'm just sharing, that would be more compelling to me. And not just you, sir. I'm just saying across the board. I have not heard that compelling argument in the different times that we've heard this testimony. Thank you.
Okay, if no other questions, we'll go to Champ McCullough.
Thank you, Madam Chairman. Champ McCullough on behalf of the Maryland Associated General Contractors. You have written testimony, and I don't want to belabor the point, just to point out, however, that this affects all employers, not just seasonal employers. And so clarity between the employer and the employee regarding what are the terms under which the employee can take advantage of SSL benefits everyone. And that's all I would like to add, Madam Chairman.
Well, I think you raised a very important point. And what are your specifications of what do you do when you hire the person to make sure you don't have a problem later?
Well, the most important thing and the easiest thing to do is to have a very clear written policy. And with any new employee, part of the onboarding is to go over the policies that are going to affect that employee on the job. So if there's clarity and it's clear from the beginning to the employee that, okay, if I want to take leave, I really do have to provide verification, whether it's treatment or letter or whatever else it might be, then the employee is on notice and not inhibited from taking legitimate leave, but perhaps inhibited from taking leave that's not quite so legitimate.
Okay. Are there other questions for this witness?
Senator Hershey.
Senator Hershey.
Thank you, Madam Chair. And Champ, I thank you because I think this was the first conversation we've actually had about what the bill says. I mean, very specifically, all this bill does is outline the manner in which an employer talks to an employee about providing verification at the time paid sick leave is being used. It's not about, we're not changing anything with respect to what type of verification has to be done, whether it's a doctor's office note or any of that type of thing. We're just changing it, or the bill is just changing it from something that was extremely vague, where the employee had to agree to the verification that they've been notified. Rather, now we want to do like is done so much in employment and labor law, where the employer puts it down in writing and says, this is the policy now. If you want to use paid sick leave from day 107 to 120, you have to provide us notification or verification that you were sick. Isn't that what the bill is all about, Jim?
That's what I read the bill as doing, Senator.
Right. So I think we've gotten kind of off what the bill is doing and really back into, normal things that we would say, and Champ, you said it right, an onboarding process. We just want to make sure that there is a notification that's being provided to the employee that this is how you will use it, not the vagueness that we had in the bill that we originally passed.
Okay.
I don't know,
Thank
it's
you.
just confusing.
All right, we'll go in next to Corey Johnson, who's unfavorable.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Corey Johnson, and I'm an attorney and the Senior Policy Research Analyst at the Job Opportunities Task Force. Our mission at JOTF is to advocate policies that increase the skills and job opportunities for low-skilled, low-wage workers. More importantly, we are committed to eliminating barriers to meaningful employment. We oppose Senate Bill 594 as a means of ensuring that hardworking Marylanders can continue to access our paid sick and safe leave law without having to risk their job, paycheck, or financial security. In 2018, we worked with over 150 partners to pass the Maryland Healthy Working Families Act to ensure that a majority of the hardworking Marylanders have access to 5 business days of paid or unpaid safe and sick leave. Senate Bill 594 now seeks to restrict the use of sick and safe leave to the verifications and regulations of the employer, which is counter to the bill's purpose. I would like to reiterate that earned paid sick leave is not a privilege, but is an earned right that is accrued by an individual through the number of hours they work for their employer. Mr. Melvin Thompson's framing as a taking advantage of leave seems like misplaced and criminalizing terminology for leave that has been earned by hardworking Marylanders. The restricting of those rights in the midst of a pandemic is not only egregious, but generates a level of insensitivity for the most vulnerable Marylanders and would violate their right to privacy. Verification, although not specified, has largely been categorized by doctor's notes. Requiring individuals to provide verification for sick leave that they have earned creates a burdensome policy that will have disparate impact to various marginalized communities, such as religious communities, low-wage workers, and many other individuals. As my time is limited, I would like to highlight 2 of those, which is 1, the burden to religious communities, and 2, individuals living below the poverty line. Senate Bill 594's requirement of medical verification places an excessive burden on many individuals' right to freedom of religion. As the committee knows, under constitutional law, the Establishment Clause prohibits laws that purport to aid or establish a religion. Specifically, under the Supreme Court precedent, a law that is spatially neutral but interferes with the free exercise of a religion must allow for accommodation. Senate Bill 594 not only fails to do that, but directly requires medical practitioner verifications to receive access to an individual's earned sick leave, placing an unduly burdensome requirement to individuals that embrace religious practices that do not allow the use of certain Western or traditional medications or psychological treatments, such as Jehovah's Witnesses, Amish individuals, Muslim individuals, and Christian Scientists. 1.4 of Marylanders are Muslim. 1% of Marylanders are Jehovah's Witnesses. These minority religions equate to the violation of constitutional right, the violation of the constitutional rights of approximately 10% of Marylanders. Finally, I would like to also highlight that many low-income families do not have funds to obtain affordable health care. In 2019, the Census Bureau reported that 6% of Marylanders are not covered by private or public health insurance. The Baltimore Sun reported that this is approximately 130,000 Marylanders. The number of uninsured Marylanders is overwhelmingly represented by the most financially vulnerable communities that exist in between the working class and the poverty and those that live below the poverty line. Senate Bill 594 would result in financially burdensome fees that will further lock many low-wage workers into poverty. For the reasons above, we urge an unfavorable report of Senate Bill 594.
Thank you. Are there questions of this witness? Senator Hershey.
Thank you, Madam Chair. Corey, you're very passionate. Ms. Johnson, you're very passionate. I think you've missed the mark a little bit, though. I'm trying to find out in the bill where you mentioned that medical verification was required. As we learned when we went through the process in 2017 on paid sick leave, it was very broad on the different types of uses for paid sick leave. And, being sick was not one, not the only one. So where do you see that it is required that you must provide medical verification in order to use this leave?
Thank you for that question, Senator Hershey. I would like to posit to you all that there's a difference between capital P policy and then lower P policy. This type of legislation allows for a certain type of mechanism where it gives employers free range to determine what that verification looks like. And not only does it allow for the free range of that verification, but as it's been articulated by the individuals that have, spoken in favor, it seems like that verification looks like medical verification. And so even if it isn't explicit, it doesn't limit out the ways that employers could violate the constitutional rights of individuals. And in fact, it looks like it almost implies it. So even if it's not explicit, I would say that that's a problem of the bill, because it doesn't limit out the ways that employers can violate individuals or employees' constitutional rights. But I will also
agree
that it implies the violation of constitutional rights.
Ms. Johnson, I would agree. There are a lot of problems with this bill, and obviously with the paid sick leave policy that we put together. And some of this was intentionally left vague, so we wouldn't be having this discussion. But part of the broadness of this policy, and as you just said, some of the what we're finding out once this bill has been implemented is that there are problems with it. And I think what the bill sponsor is trying to do right here, if you look specifically at what the bill does, is just change the way the employee and the employer make that agreement at the beginning of the term of employment. That's all this does. It just simply says, instead of an employee agreeing to provide verification, that more specifically, it tightens this up, that the employer needs to provide the written notice on how verification or about the verification, the requirement for verification. And I'm sure if you've been involved in other employment law, as I said with Melvin earlier, I'm sure there are a number of conditions that occur in writing when an employee and an employer come together on a contract of employment. And I just don't understand why adding this to that level, or to that document, or to that, as Melvin says, onboarding process is a problem. It's very simple that you're just codifying the agreement between the employee and the employer, and you're making sure that the employee knows up front that if they use paid sick leave between days 107 and 120, that they'll have to provide some verification, which is already in the bill.
I would just like to say that I don't think that employees and employers have the same amount of bargaining power when entering into an agreement.
This isn't about bargaining, Ms. Johnson. It's just simply the agreement. The conditions of pay, the salary, the terms, all that's been done. You guys have fought very hard for paid sick leave. The businesses are trying now to implement that. And all they want to say is that there's been a discrepancy on how, not what type of verification, but just how it's been acknowledged that the employee and the employer are on the same page on providing that verification. Not what kind it is, just on the same page about how they provide that. That's all. Thank you, Madam Chair.
Let me just butt in, and just listening to this colloquy, would it make a difference if you wanted verification, period, at any point during the period of employment, and not just pick those days? Because they do suggest that you have a suspicion that people are going to do a particular thing that is immoral or to the employer's disadvantage during a particular period of time.
Right, and Madam Chair, the current law already states that an employer may ask an employee for verification if the leave is used for more than 2 consecutive scheduled shifts. That's current law. Okay, what
And
we
you'll
did,
find that that's not sufficient, but what more would you learn by saying now, by passing this bill then?
we're not changing that part of it. And that's what I'm saying. That part's not coming any further. What we're doing is in the second part of this that deals with days 107 to 120, we need to make sure that the employee and the employer are on the same page on how or what verification is, or just that verification is necessary to use it during that period of time.
But would the same kind of verification that works during days 4 or 7 or 9 work?
Absolutely. That still works.
Well, because the way this is framed makes it appear, and if I were the young person coming for the seasonal employment, that you expect that I'm going to be dishonest and that I'm more likely to be dishonest is as if I'm bearing a burden to your expectations when I haven't done anything necessarily wrong.
And Madam Chair, I would clarify.
No, you're done.
Okay, I'm sorry.
Chair, I would just say that this was a very contentious issue when we did the entire bill in 2017, and as Senator Carrozza said, we looked at a 90-day period that we all thought was the summer time or when seasonal employees would work. What we recognize is there are shoulders. Ocean City is broadening the time in which people are coming down to the beach, and as well as other vacation areas. And they wanted to make sure that the employers wanted to make sure that they were protected, that individuals wouldn't start, unnecessarily using paid sick leave during this period of time. And unfortunately, this was probably not a great compromise. And unfortunately, as you can see, it's very vague. And I think what we're just trying to do with this is clarify some things, at least on the upfront side, not necessarily after the fact, not necessarily when an employee is asking for paid sick leave or using it, but just upfront the notification process.
Okay, thank you. Now let's see. And that ends the testimony on that bill. Thank you. We're going next to Senator Klostermeyer, Senate Bill 653, Labor and Employment Healthy Working Families Act application.
Okay, are we ready?
Yes.
Okay, Senate Bill 653 as presented removes the current exemption from the Healthy Working Families Act for construction workers who waive the application of the act in their collective bargaining agreement. Before I go any further, I am offering an amendment that narrows the scope of the bill to remove the exemption for laborers working in the construction industry. Should this amendment be adopted, the legislation will no longer apply to other members of the building trades. The bill with this amendment also does not affect any other provisions in the Healthy Working Families Act. Laborers are generally the lowest paid craft amongst construction workers. Many of these laborers live paycheck to paycheck and would be financially devastated by an illness that results in unpaid absence. Applying the Healthy Working Families Act to construction laborers will ensure that these workers receive the benefits that they have rightly earned. With me today, I have Bill Kress on behalf of the Laborers International Union of America to explain the importance of removing this exemption for laborers. I thank the committee for their consideration of Senate Bill 653 and ask for a quick, favorable report.
Thanks. Are there any questions of the sponsor? Okay, then we're going next to Bill Kress, and you have 5 minutes.
Thank you, Madam Chair, members of the committee. Bill Kress here today on behalf of the Baltimore Washington Labor District Council in support of the bill. And as the senator mentioned, and let me just back up to give the committee a little background on the current exemption for construction workers. So under the act now, if you have a collective bargaining agreement which expressly waives the act, then those workers are not entitled to sick leave per the statute. What my client has found is that there's been an imbalance of bargaining between the parties, and that the contractors are demanding that they expressly waive the sick leave provisions. And so what this bill would do with the narrowly drafted amendment would apply the sick leave to all laborers regardless of union affiliation or not. We have talked to some of the folks who are in opposition today, and I think that the amendment should address their concerns. But let me say that I've heard that they're concerned about the definition of labor. But I would ask you to look at the actual act itself. All laborers are covered unless it is expressly waived in a collective bargaining agreement. Those collective bargaining agreements are typically with the laborers union. It's a defined population of workers. So I don't think there's any doubt about who we're talking about with respect to laborers. I don't think we need a definition. But if the committee would go in that direction, we'd be happy to work with the committee to come up with some language. Let me address one other issue that may come to mind, and that is whether or not, if you pass a new bill, a new law, whether it would apply to existing contracts. And in the committee's wisdom, you may find that you should grandfather as existing contracts, the existing collective bargaining agreements. We would not be in opposition to that if that's something you wanted to do, but we would leave that up to the committee. Finally, let me say that in the interest of time, my client wanted to bring in some of the workers who have been struggling during the recent pandemic and have lost time on the job to devastating results. But in the interest of time, we thought that we would just present this bill simply. I know the committee understands the impact of losing time when you're one of the lowest paid professions on a construction work site. When these folks are out of work, it can be absolutely devastating to their family. So we think it would make sense to apply to remove the exemption just specifically to laborers. And we hopefully that'll address the concerns of some of the opposition. So with that, I'll end my testimony. Thank you, Madam Chair.
Okay, are there any questions of this witness? Okay, then we're going next to Ellen Valentino, Maryland Mechanic Machinist Contractors Association.
Sure. Thank you and good afternoon. My name is Ellen Valentino. I'm here today representing the mechanical contractors of Maryland, and in opposition to the legislation. You know, the impact of the legislation is significant to us. You know, at the same time, we do respect and understand that the proponents feel the same from their perspective. We do hear their testimony, but, you know, the paid sick leave law, as you've heard in the previous bill and this one, you know, went down a long path of enactment with, you know, every exemption and wording almost being pulled through a fine-tooth comb. Some would say, I would say, I do remember the conversation well on this one and the construction exemption. And although it was controversial, this was one, and I want to stop short of talking in absolute. I thought consensus did exist between the construction employers and labor and labor unions on this portion. But nevertheless, you know, the bill and the amendment, although it appears simple, is complex. And when it's put into practice, it could really have unintended consequences that we believe do need more study. An example of the complexity would be, you know, how to capture this leave, who pays this leave if we have an individual in more than one work site or more than one employer with varying hours. This is not uncommon with respect to this. And, you know, additionally, you could have laborers under this specific thing that would qualify for an employee benefit that the apprentice and journey people currently do not receive under a waiver negotiated in good faith by these parties. So an unintended consequence, and, you know, I know this is not the sponsor's intent, but it could be a deterrent to hire, particularly with respect to construction projects that, you're right, are currently bid and underway, but then also construction projects in the future. So, you know, what do we ask? You know, we're asking, we need more time to assess the impact. We do. And this amendment is broad. And, you know, we need to understand its impact on our industry, our current workforce tiers. And for these reasons, we do ask for an unfavorable report. Thank you.
Madam Chair, could I?
From your perspective, and I'll get to you in a second,
Sure.
Mr. Vice Chair. Is the status quo situation that these laborers do or do not have time. I don't know. I'm not sure I'm understanding the bill from what I heard so far.
Thank you. And Chuck Daniels from the Contractors Association is going to follow as well. He may be able to, shine further light on what's in practice currently today and, what an impact would be as well.
Do some of these laborers work for a different contractor every day? Are they kind of like freelancers?
Madam Chair, I could answer these questions for you. So the current statute allows the laborers to enter into an agreement with a contractor to waive the sick leave provisions. And so there are multiple contractors that have agreements with the laborers union, and it just depends upon what job site the contractors are working on. But those employees who are laborers are members of the laborers union, if that answers your question. But in order to waive the sick leave, it has to be expressly provided in the collective bargaining agreement.
Okay, I'm gonna have to listen to the other people who still signed up. But let me go to Corey Johnson. Oh, that's right, Senator Feldman had a question.
Well, just Ellen, just real quickly, I'm just trying to understand like how this bill impacts your client. So mechanical contractors, I thought, and correct me if I'm wrong, I mean, I thought it's steam fitters, plumbers. Like, how does this bill as amended have any impact on the folks that you're here representing? If I understand who you're representing in your opposition testimony, does the bill impact?
Yeah, the bill does impact, and that's why we're here in opposition. But Chuck Daniels, who is the president of the Mechanical Contractors Association, is going to be testifying, and I think he may be able to put more descriptive answer to your question.
Okay, Madam Chair, we'll leave it at that. We'll listen to this.
Okay. All right, well, then we'll go on to Charles Daniels.
You're on mute there, Chuck.
Forgive me. Thank you. Good afternoon, Madam Chair, Senator Klaus Meyer, and members of the committee. My name is Chuck Daniel, and I represent the Mechanical Contractors Association. MCA represents primarily small businesses, middle market businesses, and family-owned businesses in the plumbing and HVAC industry. These are the local businesses that safely keep you warm when it's cold and keep you comfortable when it's hot. MCA Maryland is in opposition to SB 653. As you all know, just a couple of years ago, the state of Maryland adopted employer-paid sick leave, but the state granted an exemption to businesses in the construction industry that operated under a collective bargaining agreement if the employers and their labor partners chose to negotiate in good faith an alternative benefit or another option. In the market in which our job providers operate, this exemption has been a win-win for both job providers and their labor partners. The administration of paid sick leave under a multi-employer construction framework is very difficult. In our unique world, an apprentice or journey person could be working at a construction site for employer A on Monday, employer B on Tuesday, employer C on Wednesday, employer D on Thursday, and so on. It's very difficult to track for our construction job providers. Then compound the matter in the construction industry with the many jurisdictions where job sites are located in our area: Maryland, DC, Virginia, Delaware, West Virginia. Which company should pay for it, and what state or jurisdiction governs it? Conversely, our labor partners needn't worry about the specifics in the law. For example, required hours worked, length of time with an employer, and so on. In short, the outcome has in fact been a win-win for both job providers and the labor partners. The construction job providers needn't deal with the tracking administration, and perhaps more importantly, our labor partners negotiated an alternative benefit that's equal to or better than the law requires. Thank you.
Okay, I think that was helpful to me. So these are not people who are the ongoing employees of a particular company. They are available for work with their skill at their skill level, and on a daily basis, various companies might contract with them for work on that day.
That's exactly right, ma'am. They
And
are
so
literally,
because of that, that's why you didn't have the sick leave before.
Yes,
Because
ma'am.
you're working in various locations for various employers from day to day. And everybody knows that's the arrangement. And now they want to change that.
Madam Chair, if I could just clarify.
Well, you know what? You can't today.
Okay, thank you.
But you can get back to us.
Sure.
We're willing to talk to you, but you had your time. Okay. Senator Kramer.
Thank you, Madam Chair. But with all due respect, I would like to ask Mr. Kress, because that's why we're here right now, to clarify that issue so that we do have a thorough understanding of what's happening, because I'm hearing about alternative benefits and other options. And
Go ahead and ask your question.
All right. So Mr. Kress, could you clarify that, please, and the circumstances so that we fully understand this issue in its entirety?
Sure. So, Madam Chair, let me back up. We're talking about skilled construction workers. We're not talking about day laborers. These folks work on construction sites, and they work on gas infrastructure, things of that nature, highway projects. They are employees of contractors, and most of them work, throughout the year unless the industry or the job has ended and there's no additional work. So we're not talking about day laborers. We're talking about skilled construction workers who actually go through an apprenticeship program. And all of those workers in that workspace right now are covered by the Sick Leave Act, unless the union agreement expressly waives the sick leave provisions. So we're not talking about day laborers or anything of that nature.
So, Mr. Daniel, then my question for you, sir, who are these individuals that are not working for a company, but are popping up on construction sites all over the place, as opposed to, I'm assuming you're representing an industry of mechanical contractors. Do I understand that correctly?
Yes, sir.
And those mechanical contractors hire employees, don't they?
Yes, sir.
And then you all assign those employees to construction sites wherever they may be. Wouldn't that be accurate?
Where there's a need. That's exactly right.
All right. So I guess I'm confused then, and maybe you can better explain it. How is it that these employees can't be traced back to a single business or a single entity when they're working for ABC, mechanical company, or, Three Brothers mechanical company, but they're being sent out to job sites that may be in different places, but they are working for a company. Do I understand that correctly?
That's correct. But the challenge is the rotation of the construction industry. So you might be working in Towson one day, for one company, you may be working in Terry Hall another day on a construction site. You could be working in Annapolis the third day, all for different employers. And that's the challenge.
Well, but they're working for the same employer. They're just working on a different job site.
That's forgive me. That's not necessarily the case. In fact, it's often not the case. They're often working for different employers over the course of 2 weeks or 4 weeks or 6 weeks or 3 months. They could literally be working for 3 or 4 different companies in 1 week.
So if I'm with ABC Mechanical Company, you're saying that I'm not working on jobs that ABC Mechanical is hired to do the workload, so that, I work for ABC Mechanical and 3 or 4 other mechanical companies. How would that work?
It does happen. That's a regular practice in the construction industry. That does work. It's very difficult to. It's a very unique industry, the construction industry, to the extent that it's in a multi-employer framework under a collective bargaining agreement. It's not like. I'm just
not sure why is that something. In other words, if I work for Feldman Plumbing, I'm not also working for Klausmeyer Plumbing. So why is it that you're saying in your industry somehow these same people are working for 5 or 6 different companies all at the same time? That there's something there that doesn't sound quite right. Do you follow what I'm saying? There's
what you just said is certainly an extreme example, but it does happen. And really, you think about over the course of a 90-day period, you could find yourself working for multiple construction companies over the course of a few months, and that's why it's very difficult to track it. And of course, eligibility under the law becomes difficult because there are.
Would you define for me what a construction company is then? Because it sounds like we're interchanging working for the mechanical companies that you represent, and then you say, but you're working for multiple construction companies. So there's construction industry, like a general contractor, and then there's what you do. HVAC or mechanical contracting or plumbing or electrical, wiring. So you've got, I think all of us on the committee very confused. And that's why I'm trying to get to what it is specifically, because you're saying you're working for multiple contractors. What contractors?
The members of our organization. This is not like a young person working for Amazon for 2 years. It's a different framework. It's very different. My employer is MCA Maryland. I know who my employer is today, tomorrow, next week. It's not always the case in this industry when you have a multi-employer framework with companies in the mechanical space that are subject to a collective bargaining agreement. And maybe I should ask Ellen to chime in on this. Maybe I'm not answering.
No.
All right. Yeah. Thank you, Madam Chair. There's something there that just doesn't sound quite right. And, but I appreciate it. Thank you, Mr. Daniel.
Thank you.
All right, Senator Klausmeyer.
Yes, I just want to ask Bill, what about the building trades position? Where are they? And
they're unopposed to the bill with the
one
amendment.
other question, Bill, but just, do you understand what Chuck is talking about? I just want to make sure he's taken care of.
I honestly, I don't. I could tell you from my own personal experience, some of the committee members may know this, but in my early life, I worked as a construction electrician. I have 15 years of knowledge of working in the construction industry. I have no idea what he's talking about.
That's not.
All right. Well, we can't go back and forth. I'm going to suggest that the sponsor get with her proponents and figure out what they're talking about, and that you work with the opponents to be sure that they understand what you're talking about, because it isn't clear to us as members of the committee as to exactly who is involved, what kinds of workers, under what circumstances. My father was a general contractor, and when I kept listening, when he hired people, they worked basically for him, and then he had subcontracts with the HVAC people and the electricians and so on, and then they had their own staffs. So I am confused. And so we can't spend the whole day. We'll hold the bill and wait and let you guys figure out what the bill really does and what you want us to consider, and we'll expect you to get back to us.
We will. We'll get
okay, thank you.
Together.
All right, we're going now to Senator Bottle, Senate Bill 704, nursing home transfers of ownership, site visits, and surveys. And Senator, you know the drill. You have unlimited time to lay out the bill, and Claudia Baylog is your chief proponent, and so that person will have the 5 minutes, and the rest will have 2.5.
Pam, you're muted, Pam. Pam, you're muted. Senator Biles, maybe.
There we go. I'm sorry. I'm sorry. I was all ready and I just
How
didn't
long
know.
did they say?
Okay. Thank you. All right, let me try again. Chair Kelly, Vice Chair Feldman, and members of the committee, thank you for hearing Senate Bill 704. For the record, this is Senator Pam Vital, District 32. Nursing homes should be a place for our elderly population to feel safe and for their loved ones to have confidence that their elderly family members are provided with good quality care. To accomplish this, the Office of Healthcare Quality, OHCQ, does unannounced surveys for the nursing homes in our state annually. Sometimes it's every 15 months. The surveys are carefully conducted and any corrections that needed to be made are typically made as required. So recently, out-of-state REITs, that's real estate investment firms, and other types of investment firms are purchasing nursing homes, frequently ones that are failing financially. However, instead of enhancing and improving the home, cost-cutting measures are put in place in an effort to provide a return for the investors. So when I talked with OHCQ about this issue and the Healthcare Commission, we don't want to stop purchasing of nursing homes because sometimes the homes are going to close if they don't have someone bail them out. But on the other hand, these out-of-state companies are not necessarily buying them for the right motives. So what happens when an investment company or REIT purchases a nursing home? Well, here are some headlines in the testimony that I've written for you. There's 5 articles that are really, or 4 articles that are very horrific, really, about what's happening in these nursing homes that are bought by investment companies. It's happening all over the country. It's not just in Maryland. So it's not practical to prohibit the practice, but we do need to find some way to supervise this transfer of nursing homes. When one nursing home in Hagerstown had to be closed, patients were spread all over the state. You know, they were finding places for these patients to be housed, and some even ended up in Pennsylvania. So that's not good for the families to have their loved ones far away for them to even visit. So Senate Bill 704 was as drafted requires that the OHCQ inspect the recently purchased nursing homes more frequently. Now the bill says they would inspect or do a survey at 1 month, 3 months, and 6 months. But what we learned is that made a really expensive fiscal note. So the House has already heard the cross-file and they're working on amendments that would just require a full survey at 3 months and a follow-up at 120 days or 4 months to re-inspect after the full survey was done. And this will help the fiscal note a lot. There were only 6 nursing homes last year transferred to REITs or investment companies. So it's not widespread, but it is happening. In a recent Washington Post article that was published in December, we learned about a company named Porta Piccolo that is wholly managed, and the nursing homes are run by their wholly owned management company, Peak. And the Washington Post article is in your testimony, but they ended up, after finally complaints got through to OHCQ, and employees and family members can make anonymous complaints. But once the complaints were heard and OHCQ came out to visit, I have 64 pages of the federal violations and 73 pages of the state violations. The Office of Healthcare Quality assessed them $730,000 in fines. And it just outlined a few of the most egregious violations that they found at Porta Piccolo in Chestertown. Employees were expected to keep working after testing positive for COVID. There was failure to secure items from local suppliers. Employees were scrambling for medications and food, sometimes going out and purchasing cleaning supplies and food, and then software prohibiting employees from accessing patient records. They were weeks without hot water. Can you imagine during a pandemic, they didn't have hot water for dishes, for laundry. They had to be directed to replace the hot water boiler system. Porta Piccolo purchased 20 nursing homes during the pandemic, and 8 were in Maryland. So this bill is an attempt to protect our most vulnerable senior citizens. Thank you for your consideration of Senate Bill 704. I urge the committee to move this bill with a favorable report, and I'm happy to take any questions.
You really paint a bleak picture of what's going on. And I recently read that many nursing homes that say they are nonprofits are making money because they own the companies that provide all the services they use. And they make their money that way, and then they claim that the shell of the under which all the others fall is the nonprofit. Okay. Are there, what? Senator Augustine.
Thank you, Chair Kelly. First of all, I just thank you, Senator Bottle. You and I have talked about this at length, and I know I really do support what you're saying. I also want to just put into this conversation around the essential workers who are at that. I know we're going to hear from them, but they have been really put into, this is one of those indications of where these folks have really been put in harm's way. And that we do have these actors out here like these folks who really have not been doing right by Marylanders. So I just really appreciate being part of this and you putting this important legislation out. Thank you.
Thank you, Senator Augustine.
All right. Are there any other questions of the sponsor?
Senator Benson.
Unmute yourself.
Don't do what I did.
Okay. Yes, thank you very much. I'm going to try to do this without getting too excited, and I want to ask a question. You know, I just lost my beloved sister. She was in a nursing rehab facility. Lack of oversight of this facility is very troubling. My sister had diamond rings. I don't know why her son allowed her to wear them into the facility. But when she came out, they were gone. Mm. It turned out the rings had a value of about $5,000. One of the workers took the rings home. Her clothes, her shoes, my mother's Afghan. There's a list of about 6 or 7 things that are gone. And we cannot get, when I talk with the county, the people who are in charge of family services are telling me that they have no control over this nursing home, this rehab center, that the oversight comes from Baltimore. We've got to do something about the nursing homes are a problem. And what do we do with these nursing homes where you're not allowed to go in to see your loved ones? I know there's a bill in that deals with that. The condition of the nursing homes. We sent my sister flowers. We never knew whether or not she received them because no one was willing to tell us whether or not she received the flowers. All kinds of things. So I'm just wondering, is this piece of legislation strong enough to address the problems that we're trying to attack? Because something needs to happen with the oversight of the nursing homes. Do we put an amendment in that would give control of the oversight to the local family services or the health departments or somebody? Because it doesn't have oversight except for Baltimore. Does your bill deal with that?
Senator Benson, it is a state issue. It's the Office of Healthcare Quality under the Health Department that handles the oversight. But there's also the ombudsman, there's a number of ombudsmen statewide, and they can help with issues like that. But it is state, it is under the Health Department.
Yeah, we need to do so. It seems to me that we need to do something because there are all kinds of complaints from people about nursing homes. I'm telling you, it is so terrible. And with this pandemic, the family members cannot get into the facility to see what's going on with their loved ones, which causes all kinds of problems.
Right.
So you might want to follow up with the Office of Healthcare Quality about what happened.
I've been trying to call Dr. Nate to no avail.
Okay.
She is busy, Senator Benson, that's for sure.
Okay. Are there other questions of the sponsor? Okay, you brought something really important to us, and I think we all care about these issues. All right, Claudia Baylog, you have 5 minutes.
Thank you, Madam Chair and members of the committee. My name is Claudia Baylog. I'm a lead researcher with 1199 SEIU. We represent 10,000 healthcare workers in Maryland and DC, and I'm here in support of SB 704 and to request a favorable report by this committee. So our members work as CNAs, GNAs, CMAs, LPNs, dietary workers, and housekeepers in skilled nursing facilities throughout Maryland. This pandemic has exposed the vulnerabilities in our nursing homes. Our union has been sounding the alarm about data that's been emerging as nursing homes are increasingly sold to out-of-state private equity owners. The recent article published in the Washington Post described horrific failures to maintain quality standards when New Jersey-based Porto Piccolo purchased homes here, operating as Peak Health. And Senator Beidel described the situation in Chestertown. I'm here to try and convey how these conditions can regularly take a turn for the worse with these kinds of ownership transactions. So the evidence is mounting that private equity buyouts of financially distressed nursing homes are linked to worsening staff shortages, lower quality care, poorer inspections, and declines in resident health outcomes. The latest report on this was published just a few days ago and showed a disturbing correlation between private equity ownership and increased mortality rates. Another report published a few months ago showed that nursing home staffing levels declined following private equity buyouts. This is because the only way that PE firms can make a profit is to slash costs on homes that were already struggling, and they usually have CMS ratings of 1 or 2 stars. So we need to look at this issue with a clear understanding that more out-of-state investors are going to come here to buy distressed nursing homes in our state, and census numbers are low everywhere. Now, I want to talk specifically about what happens when a new out-of-state owner comes in. So workers often don't learn that their facility is changing operators until a new manager walks through the building or a new sign goes on the door. But we know that these transfers of ownership are not seamless. An out-of-state ownership change generally means that pay will be cut, benefits will be cut, and critical investments in the facility will fall short. And from the perspective of family members and residents, short staffing could worsen. When a series of Genesis homes were sold and operated as Peak Health, our members immediately had to fight for their pay and benefits at those facilities. After Peak took over, the managers went after their health insurance plans, increased their co-pays. They wanted to eliminate paid time off. Peak Health even refused to pay raises that were already negotiated, while staff were putting their lives and their families at risk. And I want to note something about short staffing. It isn't just a GNA or CNA problem. Slashing costs include staff like dietary workers and housekeepers. So I spoke to one worker who pointed out that it takes teamwork to care for residents. If she loses any of her coworkers, her job is much harder. When a housekeeper's hours are shut, the ability to ensure safe and hygienic environments is undercut. And this conversation should not just be about Porto Piccolo as an individual actor. We represent workers at homes that were purchased by other PE firms like Vita Health, also based in New Jersey. I spoke with a worker at a Vita Health owned facility who described the transition as chaotic. Multiple administrators have come and gone, and she and her coworkers had to fight to maintain wages outlined in their contracts. Now, at her facility, instead of investing in staffing and supplies, the new owners invested in a union-busting consultant to rid the facility of the union because, again, the only way these firms can turn a profit is to slash costs. And the truth is, some workers will choose to quit when faced with these conditions. In a best case scenario, we'll see staff scheduling changes with aides moved around to different units, but even this can upset residents, and their family members also worry when their loved ones lose continuity of care. I want to note that we absolutely understand the challenges this industry faced to provide PPE for their staff. We know how many nursing homes had to team up with hospitals, and they struggled to find ways to secure PPE. But in many of these for-profit homes, our union had to step in regularly to deliver masks to our members. Too many workers were using their off hours to go to stores themselves to purchase gloves and cleaning supplies. We think this bill makes sense. We think an increased inspection schedule for these facilities is smart because of the short staffing that can result from these transfers that can disrupt care. 1199 appreciates the work of the bill sponsors to give the state more tools to address these concerns, and we hope for a favorable report. And I want to personally extend my condolences to Senator Benson while I'm here. Thank you.
Thank you. Let me ask you, I noticed the sponsor has the required site visits at 1 month after transfer, 3 months, and 6 months. Do you think some kind of audits ought to additionally have to be specified to see how they're working, what the pay structure is, whether they own the suppliers? Because I've been reading that a lot of nursing homes are making it by owning the company. They claim to be nonprofit, so they aren't paying taxes, but they own all of the companies that are supplying them with services.
Thank you, Chair Kelly. So this is a tricky question because this again hinges on state resources. And you're absolutely right. You know, the ownership of these companies can be complex. And we have a problem when we're tasking an agency such as the Office of Healthcare Quality to also suddenly become financial analysts to investigate the structures of these companies. So this is a great question because we're really trying to figure out how can these audits be done? How can these audits be accomplished given sort of the regulatory structure that we're living under right now? And I think that resources do need to be devoted to these transactions and uncovering, you know, you're absolutely right. Like when you pointed out the inside, the internal conflicts of interest that arise in these firms. I don't know that I would want to speak for Dr. Ney and the Office of Healthcare Quality and propose that their staff has to take on this burden as well.
But it seems somebody in the state should understand inside out, and in fact, maybe should have to put their imprimatur on it before it could be finalized, that it is a workable arrangement that can keep up quality.
Yes.
Okay, this is really serious stuff. Are there other questions for this witness? You got a good major proponent, Madam Sponsor. Okay, thank you very much. I may contact you if you don't mind. We got to keep working. We got to do better. Okay, we're going now to Allison Saborowski, Leading Age Maryland.
Thank you, Madam Chair and members of the committee. My name is Allison Saborowski, and I serve as the President and CEO of Leading Age Maryland. And we are here today to request a favorable report on Senate Bill 704, and you have our written testimony. So Leading Age Maryland is a community of about 120 not-for-profit aging services organizations in the state. And we represent continuing care retirement communities, affordable senior housing, assisted living, nursing homes, and home and community-based services like hospice and other groups. So ensuring quality care in nursing homes and other care settings is of paramount importance. And as we've already heard today, there are certainly situations where a nursing home may be experiencing financial trouble, and the transfer of ownership protects both the residents and staff of the home from having to move or seek employment elsewhere. And this may even become more common as we enter a post-COVID era. Through the regulatory process, we would urge the Maryland Healthcare Commission and the Office of Healthcare Quality to determine how the state of Maryland can best understand, prevent, and respond to potential quality issues related to transfers of ownership. I'd like to note a recent Health Affairs article that details practical solutions that improve nursing home ownership and financial transparency in the post-COVID-19 period. Many of these solutions would require a collaborative process between the federal government through CMS and the individual state. While Leading Age Maryland is an association of nonprofit providers, about 70% of nursing homes are operated by for-profit corporations. 24% of the facilities are not-for-profit and 7% are government-owned, roughly, while 58% are operated by corporate chains. An increase in investor-owned regional and national chains has led to complex organizational structures. There should be a clear process and standards in place for ensuring that buyers are capable of and prepared to effectively manage nursing home operations. Any additional measures the state enacts, whether in the approval process or increased survey oversight, should be thoughtfully considered. The goal should be to effectively ensure quality and not to create a system that might deter effective operators who could potentially improve quality in struggling homes. In closing, we applaud the sponsor's goal to ensure quality care in nursing homes through greater oversight and standards of new owners and operators within the state. For these reasons, we respectfully request a favorable report on Senate Bill 704.
Thank you. Are there questions for this witness? Okay, very good testimony, very informative. Okay, let's go to Eric Colomaro at the Alzheimer's Association.
Chair Kelly and Vice Chair Feldman, Eric Colchmiro, Director of Government Affairs with the Alzheimer's Association, and also a fan of the lead proponent, who I think really outlined these issues really well for us today. Thank you to the sponsor for bringing this bill forward. And I'm here today as the Alzheimer's Association, a member of the Oversight Committee for the quality of care in nursing homes and assisted living facilities, has long been concerned about the long-term care industry, as over 40% of the residents in nursing homes and assisted living facilities have Alzheimer's or another form of dementia. More than 95% of these residents have another chronic condition. Their care is complicated. The Washington Post article about Porto Piccolo speaks to a systemic issue in long-term care. Long-term care facilities, and especially nursing homes, are moving away from being small, family-owned businesses. In particular, real estate investment trusts, by definition, a company that owns and in most cases operates income-producing real estate, have dramatically expanded their ownership of nursing homes in the United States. Yet these for-profit companies disproportionately lag behind their nonprofit counterparts in the quality of care they provide. This bill puts forward a straightforward system. It says that the current system, where out-of-state owners have to solely fill out a disclosure form to the Maryland Healthcare Commission, is not working. The bill puts a system into place where OHCQ is required to proactively check on these facilities for owners that have not operated in our state. This is not a huge burden for the Office of Healthcare Quality, yet the benefits are significant to ensure a better standard of care and to put people over profits. We need to create a more significant infrastructure for how we evaluate the business of long-term care in Maryland. This pandemic and the disproportionate impact on long-term care facilities has heightened the importance of this issue. We need the Maryland Healthcare Commission to look further into whether new owners of facilities have had significant violations. We need OHCQ empowered with more funding to help seniors more. And we need this legislation to put a standard into place so especially real estate companies are not in the business of flipping nursing homes to make money. I ask for a favorable report.
Thank you very much. Are there questions of this witness? I liked your panel, Madam Sponsor. You had some good witnesses and a lot of good information.
Thank you, Madam Chair.
Okay. All right. We are going next to Senator Feldman, 707.
Thank you, Madam Chair.
Healthcare quality. Okay.
Thank
Well,
you,
you
Madam Chair. Yeah, I think, hold on one second, Madam Chair. I think this will be, I believe, the simplest bill of the day, the narrowest, simplest bill of the day. There's no opposition. So there's a lot of talk right now about vaccines. But one of the vaccines that is a bit off the radar of everybody these days is the flu vaccine. And yet, if you look at the CDC numbers from 2019 and 20, just pre-COVID, the flu season, there was an estimated 38 million people got sick from the flu. 18 million people of that 38 visited a healthcare provider. 400,000 patients were hospitalized and 22,000 Americans lost their lives. The CDC estimated that 4.4 million cases of the flu were prevented last year through vaccination. So notwithstanding that there appears to be a bit of a downtick this year because everybody's at home, a downtick in the flu cases, I have no doubt we'll probably go back to the bigger numbers. But the fact is the flu vaccine does save lives. And that's why under current Maryland law, a law we put in place a little while back, it required that assisted living facilities let their residents and their employees know about immunization against the flu virus and pneumococcal disease. And we know how vulnerable, this committee knows how vulnerable the populations in those facilities are based on our COVID experience. So this bill 707 is very, very narrow. All it does is it simply adds a small provision to the section of the health code by requiring the Office of Healthcare Quality to actually monitor whether or not the assisted living facilities are in fact notifying their residents' employees about the flu vaccine. This will be done during their annual inspection of the facilities, which is they're already required to do. Right now, there's essentially nothing requiring that they do that. No follow-up, even though that is in Maryland law. And so, Madam Chair, that's all the bill does. It's as narrow as a bill that I present to you can be. And I've got my lead proponent to say why this is important. So that's all the bill does. I'd ask for a favorable, Madam Chair.
Thank you. Are there any questions of the sponsor? Okay, thank you. Your lead proponent, Ms. Cyphers, will have 5 minutes, and your other proponents will have 2.5 minutes. Ms. Cyphers, you're up.
Thank you so much, Madam Chair and members of the committee. I promise you I will not take all 5 minutes. I'm Maura Cyphers with Compass Government Relations. I'm here on behalf of my client, Sanofi. They strongly support this legislation. It's a simple change, like Senator Feldman said, to ensure that assisted living facilities are following through on the requirement that they post the notices for their residents and staff about the flu vaccine. There are numerous resources available online for download. The CDC has great posters that you can just print out, stick up on a cork board, and then you're done. And I think education and safety about the availability of the vaccine is really important. The flu is a big threat to folks over 65, and unfortunately, in a given flu season year, about 70 or 80% of flu-related deaths are from that population, and some of those deaths are likely preventable. And the reason why this bill is really about assisted living facilities is because overall, the Maryland Department of Health has done an excellent job on flu vaccination of healthcare workers. Virtually all healthcare workers in hospitals and nursing homes are vaccinated, but there's a pretty big lag when it comes to assisted living facilities. Only about 57% of employees there are vaccinated. So we know really how easily communicable something like this is. And so making sure that residents and staff are aware of the vaccine, it's usually free, aware of the risks of the flu, we think is actually pretty important. So we really, really appreciate your time on this bill, and appreciate Senator Feldman for bringing the bill, and thank you for your consideration of it.
Thank you. Are there any questions of this witness? Okay, very good job. We're going next to Eric Holomar.
Chair Kelly and Vice Chair Feldman, Eric Holchmero, Director of Government Affairs for the Alzheimer's Association. Thank you again for the opportunity to testify here now on SB 707. Thank you to Senator Feldman for bringing this important legislation forward. As I've mentioned, over 40% of the residents in nursing homes and assisted living facilities have Alzheimer's or another form of dementia. More than 95% of those residents have another chronic condition. Their care is complicated. This bill, specific to assisted living facilities, and there are 1,680 of them in our state, puts forward a really important issue. While the Office of Healthcare Quality is required to inspect all assisted living facilities on an annual basis, they have long lagged behind in this responsibility. The last publicly available data shows that OHCQ inspected just 71% of assisted living facilities in fiscal year 2019, following a 51% inspection rate in 2018 and a 48% inspection rate in 2017. We need to continue to raise the bar for the quality of care at these providers. This bill is a practical measure to aid seniors and reduce the spread of influenza and pneumonia. In particular, for Maryland's 1,288 assisted living providers with 10 or fewer beds, their resources to comply with existing state law may be stretched thin. While larger assisted living facilities may have the means to bring in medical providers on a regular basis, a 2-person facility in Belcamp or an 8-person facility in Accokeek may not. Additionally, existing state law only requires assisted living facilities to have a nurse on site once every 45 days. As a result, much of the existing compliance with current state law may be a piece of paper about influenza or pneumonia that never gets read or fully distributed. This legislation aids assisted living facility residents and potentially reduces the spread of communicable disease. It works toward a better standard of care amongst Maryland's many small assisted living providers. I asked for a favorable report.
Thank you. Is there any question? Are there any questions? Okay. 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 I don't see Tammy. Okay. And so that ends the testimony. I'll call Tammy to see what else she can tell us. Okay. We're going next to Senate Bill 514. Senator Feldman, you're back up.
Yeah, Madam Chair, this one, this is actually a big bill. And I really want you to indulge me a little while to go through this bill. It's the final bill of the day. So, Madam Chair, I guess I would start by referring the committee, if they have the witness list that for today's. Now, you've got, obviously we have our limitations, but you have 91 witnesses have signed up in support, 91, and we only have one witness unfavorable, Maryland Hospital Association. So I want to just lay that out there and frame it that way. It's not to mean anything other than just a numbers thing. So
important.
Yeah, this bill, the Medical Debt Protection Act, I know Senator Hershey likes titles. So when we talk about lawsuits and other collections by hospitals against patients, especially when we talk about working class, low income patients, it really has the potential of causing disastrous financial consequences, bankruptcy for some who seek out care. And really, I don't think anybody here wants to see anybody face financial ruin or become homeless just because they got sick, or fear of medical debt discouraging people to even go seek out healthcare treatment in the first place. And I think it's something we policymakers really need to address. And I think the pandemic has really even exacerbated that problem as well. So as you may recall, last year, we passed a comprehensive bill dealing with hospital financial assistance, Madam Chair, members of the committee, making it more readily available. And we passed it unanimously out of the committee. And that bill put in place some very common sense financial aid policies and practices for Maryland hospitals to follow. Now, we don't have public hospitals in Maryland. Okay, some states have public hospitals. We don't have that. So addressing the broader issue of medical debt collection practices, I think the next logical step after what we did last year to give some assistance to patients who suffer and live with the burden of hospital debt. So that's what Senate Bill 514 seeks to do. This is a topic of national import. Now, there was articles last year in the Washington Post about the University of Virginia medical system. There was front page coverage of this subject last year in the Baltimore Sun. So this is a big issue. Now, let me, and some of this information is in your packet. So let me just go through some of the data. And I will admit, in the interest of some full disclosure, I think the Maryland Hospital Association disputes some of these figures, but it's in your packet based on a report that was released last year. So between 2008 and 2018, that 10-year period, Maryland hospitals filed 145,000 lawsuits seeking about $269 million from their patients for medical debt. That's about $20 or $30 million a year. Now, this is important. The median amount owed was $944. And so these lawsuits primarily affect the low-income residents. 3 times as many lawsuits per capita were filed against residents in the lowest income regions of Maryland as compared to the highest income regions. And then some polling, I think, is in the testimony, indicates that 12% of Marylanders have medical debt they cannot pay at all, but 3 times more African Americans are in that category. So there's also a racial justice component, I think, to this issue as well. A little bit, you dig a little deeper, these lawsuits resulted in 37,370 wage garnishments, 4,432 property liens, and 3,278 bankruptcies due to medical debt. And again, many of these lawsuits, I said the average lawsuit was like $900 or something like that, were against people who likely would have qualified for free or reduced discounted medical care, or may even had disputed bills where they had appeals with their insurance companies. So that's what we're talking about here. And when you think about the pandemic over the last year, nationally, we had 12 million Americans nationally lost their employer-linked health insurance coverage, and a lot of Marylanders are still struggling with job loss. And so this only exacerbated a lot of this, this problem that I'm discussing. So what Senate Bill 514 does, Madam Chair, it just puts in place some very sensible guardrails on hospital medical debt, so that again, the families aren't plunged into a deeper cycle of poverty just because they sought medical care because they were sick. And if you look through the bill, and the fiscal note does a good job of summarizing things, here are some of the highlights in terms of these guardrails. So expanding availability of free or reduced cost care to 240 days after the treatment, because people's financial circumstances can change. Okay, they may be able to avail themselves a little later of this free or reduced. Requiring hospitals to create income-based repayment plans before sending the debt to collection. Okay, you got to go that route. Prohibit liens against a patient's primary residence. Some of these provisions are already in law in many, many other states. Preclude the hospital from reporting adverse information against about a patient to a consumer reporting agency or a suit for non-payment while there's an appeal still going on, a review of the health insurance decision. Prohibit hospitals from garnishing wages against folks who qualify for free or reduced cost care. And then having some space under the bill, 180 days after the initial bill is provided before rushing to report to a consumer reporting agency or before filing a lawsuit. Filing an action against a patient until the hospital determines whether the patient is eligible for free or reduced care. And one other, and this is the one I think the Hospital Association will push back the most on, prohibit hospitals for suing patients for medical debts of $1,000 or less. These really small dollar suits. Now, if you recall last year, I did bring in a bill that we ended up pulling. Last year's bill was up at $5,000, no suits, and that was a much higher threshold. So as a bit of a compromise, that number is all the way down to $1,000, okay? And you think about these small dollar suits, again, the average lawsuits for $944, okay, the folks that I identified, they're not gonna hire a lawyer, you know, they're for $300, so there's no lawyer involved. And so this situation is a problem. And so, Madam Chair, if you look at the things that I just described, there's a very common thread. We're trying to limit these low dollar lawsuits or rush to collection or reporting to the consumer reporting agencies for those patients who actually may qualify for free or reduced cost, or before they're given every possible opportunity to get the financial assistance they need or are eligible for, or to get into payment plans. Again, all these other things can really ruin somebody's life, either through bankruptcy or their credit's ruined for life. And that's really what the bill is about, putting these kind of guardrails in place. Now, finally, Madam Chair, because I did present the bill before I pulled it in terms of the opposition, which I said 91 witnesses in support of the Maryland Hospital Association in opposition. And the argument last year, and it's a legitimate argument, is that this could contribute to uncompensated care numbers. That if you put these guardrails in place, it could contribute to uncompensated care numbers, which in turn could have an impact on hospital rates. And that was the reason that we didn't move forward with that bill last year, this bill last year. And there's no specific number that's attached. So last year, I think the hope was that we could do an analysis of that and then come back this year having some quantifiable number to discuss. But that analysis was never done. And so the advocates went out and did their own analysis. You'll see a couple of economists from Boston University went and using this $1,000 threshold actually did an analysis, you'll see, and they concluded, and again, this is based on the lawsuit threshold, okay? And they concluded that the average hospital in Maryland would be hit to the tune of $7,000 per hospital, not likely to have a major impact on uncompensated care numbers or our all-payer model and that type of thing. But here's actually more important than that. Right now, about 1/3 of our hospitals in Maryland do not file these suits at all. So there's clearly another model that you can use to collect medical debt that don't involve small dollar lawsuits. And so that I want to make that point. Again, I will repeat, a lot of hospitals, probably 1/3, don't go that lawsuit route for $500, $800 lawsuits. So that's one point. As for the other things that I went through the list, when you talk about holding off on collection against people who either have pending appeals or against folks who are eligible for free healthcare, if it was, or payment plans, the idea that those kinds of things now having some parameters on is going to somehow have an impact on our all-payer model seems really pretty bold. And so I'll just maybe leave. So the letter of opposition you'll see from the Maryland Hospital Association is the same letter you saw last year, that this might have an impact on uncompensated care, and therefore you guys shouldn't put these very common sense guardrails in place. Now, having said all that, Government Operations Subcommittee, chaired by Senator Kramer's colleague, Delegate Cullison, has been working with MHA on this bill to try to come up with some compromise. And so I really would hope that we could get there with some amendments, some kind of compromise. I see the MIA was looking for some clarifying amendments in their opposition testimony. And so again, with all that, Madam Chair, I'll just leave it at that and ask for favorable on Senate Bill 514 with the hope that maybe HGO can help get a compromise on this. I think very important issue in all candor.
It's very important. Let me ask you, don't the hospitals have charity funds also? I know Johns Hopkins.
They do, and if you recall last year, Madam Chair, the bill that I referenced earlier about financial assistance in charity care, which we really was a real good bill. We did pass that bill last year unanimously, and that went into effect, I think, in October. And yes, that was very important as well. So that's part of this. But these, I guess I would say, is we did that last year to increase the amount of charity care, but that's different than debt collection practices.
I understand, but
okay, well, now you've got a debt on the books, your credit's at stake, you can lose your home. This is kind of the second step, I would say, in the two bills. They're kind of addressing the big issue, but in two different contexts.
I was just asking because when you describe all the hardships they put people through unnecessarily for small amounts, and then some of them at the same time aren't really using their charity money. Well,
that was the reason we passed the bill unanimously last year. We thought that was the case, and we put some stuff in there that said, you guys got to do more on that front, and that I think is going to help, and so, but it's a different. That was last year's bill, and we did, I think, a great job as a committee pushing that out.
Okay, in about 5 minutes, I have another Zoom meeting, and I'm calling on Senator Augustine to take over in a few minutes. Let's call your major person, Marceline White.
Good afternoon, Chair Kelly, members of the committee. It's good to be in front of Finance for the first time this year, and I'm proud to be here today in strong support of Senate Bill 514, and I really want to thank Senator Kelly for bringing this bill. For the record, it's Marceline White. I'm representing the Maryland Consumer Rights Coalition, which works on economic rights and financial inclusion through research, education, advocacy, and direct service. But I'm also here today representing the End Medical Debt Coalition, which is a coalition of now 52 organizations across the state, including many labor unions, people of faith, civil rights activists, patient rights activists, economic rights, legal service providers, representing more than 350,000 people across the state who have all come together in support of this legislation. So we're here today. Senator Feldman did a great job covering the issues. I just want to make a few points in my time. As he said, this committee did a great job passing the bill last year on expanding financial assistance policies. This is really the second piece of the puzzle, getting to people who already have judgments and who already have medical bills and making sure that they can afford it. What this bill does very simply is it protects working families. And it protects working families by making sure that no one loses their home, their savings, their wages, because they sought medical care at a hospital, which is what's happening right now. And it does this by ensuring there are income-based repayment plans, prohibiting lawsuits for $1,000 or less, and ensuring you can't have liens on homes, and protecting savings and garnishment. We brought the bill last year, as the senator said. Right now, it's more critical than ever that we pass this legislation. As you all know, we're facing both a health, a wealth, and an equity crisis in our state. According to the United Way's 2020 report, 39% of Marylanders right now are struggling economically. So this bill is really for them. As Senator Feldman said, MCRC commissioned a Gonzalez poll in October 2020. And in addition to the fact that 3 times as many African-American households as white households would struggle to pay bills, it's important to note that 45% of African-American households would have to use their credit cards or would be unable to pay a $500 medical bill. So again, this is also an equity issue for this committee. And importantly, it's a public health issue. Many people have lost their employer-based coverage. So many of our workers last year would now not have coverage to be able to take care of them in this health crisis, whether they have a regular medical emergency or a COVID-related emergency. So including the income-based repayment plan is critical so that people can afford to pay their bills in a way that makes sense for their pocketbook, that it's based on their income. We know now that there are many people who last year were working who this year simply couldn't afford a $1,000 or $2,000 medical bill. This legislation is for them. The income-based repayment plan is critical. Also, fear of medical debt or fear of medical debt lawsuits deters individuals from seeking care. This is never a good thing, but particularly more so during a pandemic. Finally, in this piece, COVID-19 has been found to cause issues with COVID long haulers, as you know, and many people who are leaving care after COVID have major health disease, heart disease, lung disease, and those aren't covered by federal legislation. So these people are going to need long-term care, and those costs may be simply insurmountable to them for no reason. They shouldn't lose their home or their savings because of it. And finally, we know that financial stress exacerbates health stress. So if you have a health issue and you have then financial insecurity or financial stress, it makes everything that much worse, which is why we can't be suing people because they don't have $900 at one time to pay for these medical bills. You'll hear from others about why this is an issue for working families and workers. I do want to note you have testimony in your packets about people who've lost their homes, their family homes, because they were not able to pay for a family member's medical care. That should not happen. Keeping the liens on homes is critical in the bill. I will say that to us, the advocates, this is the compromise bill. This is the compromise legislation. We did try to meet with MHA several times, but we did reduce in good faith our recommendation from $5,000 to $1,000 threshold this year. That's an 80% compromise. You may hear from the opposition that the bill's not needed because of financial assistance policies. But again, our October 2020 poll showed that 50% of African-American households polled did not know free care was available. So we need to make sure that these protections are in place so that their wages aren't garnished if they're appealing. We also have testimony from the Maryland Volunteer Lawyer Service saying most of the people they saw should have qualified for hospital assistance. But finally, this bill helps working families who would not qualify for financial assistance, but again, simply don't have $1,000, $2,000 out of pocket to pay these costs. That's why they need the income-based care. What the bill does not do is it does not harm Maryland's unique model. You have testimony from the Boston University economist, and Senator Feldman stated this would cost on average $7,000 per hospital. It does not stop hospitals from collecting debt collection for medical bills. Even if they prohibit lawsuits, they can still pursue debt collection. They can call you, they can email you, they can find you on social media, they can hurt your credit score. So there's still lots of incentives for people to pay. And again, there are many, many people who pay their debts when they're pursued by debt collection without going to court. So there's no reason to assume that would be any different in this case if we prohibited the lawsuit. Finally, I just want to note there are 4 states that do not garnish wages, 9 states that protect the family home. They do better than we do already. And there's, in addition to the 1/3 of Maryland hospitals, there are hospitals in other states that do not sue at all, and they've managed to maintain their profitability. So we know the Maryland hospitals can do this. I do also want to note that the fact of medical debt that's been sought in the lawsuits in the past is 0.18% of operating revenue and 4.2% of net income. So they can afford to make these changes. And finally, in our poll, we found that 64% of Marylanders across party lines supported prohibiting lawsuits for $1,000 or less, and 93% of Marylanders across party lines believed hospitals should institute an income-based repayment plan. So across the state, we agree. You should not lose your home, your wages, or your savings because you sought medical care. And for all of these reasons, we support Senate Bill 741, and we urge a clean bill with no weakening amendments. Thank you.
Okay. Thank you very much. Are there any questions for this witness, Senator Klausmeyer?
Yes. Marceline, I'm just concerned, and I came in late. I couldn't get back in because I was just coming back from my other bill. But where's the money coming from to pay for this?
The money that coming from to pay for this, it's simply, again, Senator, as the study from the Boston University economist shows, hospitals may have to take a little bit of a hit, but it's $7,000 on average per hospital when you look at the profits the hospitals make, and you also look at their unused charity care. Our report last year found that there was $119 million in unused charity care, and that is about the exact same amount they were suing for. So there is money available that the hospitals have to absorb many of these costs. And again, many of the people should have qualified for financial assistance in the first place. So that money is available already from the good work the state has already done.
Okay, so I guess Senator Feldman said that we used part. Is there any money left in that charity money?
Yes. And yes, there's money right now. There are reports about the amount of care. And in fact, I think there's some issues about spending all the CARES relief money, but that's a formula that's set out each year. And again, they did not spend the charity care in the past while they were suing for almost the exact same amount. So that money is available within the hospital system to take care of this.
And will this affect the our special waiver any which way?
No, there's actually a study by 2 Boston University health economists in your packet, Senator. Thank you for the question. And it actually does an estimate of what it would cost at all with the to have this threshold. And it found at most it would cost hospitals on average $7,000, which again, for these hospital care systems, that's a very, very small amount of their overall cost. I'm sorry, my cat is also feeling very passionate about this.
Okay, all right. I just think, you know, if we had that bill last year and we passed it, I thought that was going to fix the problem. So now we're still not.
Senator, I mentioned this earlier. You might not have been there. I mean, that was a really important bill of financial assistance.
Right.
It's about putting guardrails on the debt collection practices later down the road. So really 2 important bills, but kind of different, attacking this issue differently.
All right. Thank you, Vice Chair Feldman.
Okay.
And thank you, Senator Klausmeyer. I see that Senator Hershey has a question.
Oh, I don't know if I was done yet. But
oh, I'm sorry, Senator Klausmeyer.
No, I'm done.
I apologize.
No, you're down on the bottom. I was looking for the chair, so.
Yeah. If you got another question, Senator Klausmeyer, you go ahead.
No.
Okay. Senator
Okay,
Hershey.
thank you very much. Marceline, I just want to make sure I understood this correctly. You said this would only cost each hospital $7,000?
That is correct. There's the full study in your testimony, but that's based on two Boston University health economists. That's assuming that's for the $1,000 threshold. Their assumption is.
Senator Hershey, can I just say, you can look at the report yourself, but it's because it's not like if you file a suit, you don't get that money. Like I think earlier, I think it was Senator Augustine earlier today talking about, getting blood from a turnip, whatever.
Right.
There's certain cents on the dollar. So you'll see the economists, and there are certain scenarios, and they have a high end and low end, but it's not because you don't collect a certain dollar figure that under any scenario, the hospitals would be getting that much actually back. So you have to start with that point, and they do a good job there. And the other thing, as I mentioned earlier, a third of the hospitals in our state don't even file lawsuits because they figured out other ways, sending a letter. They're like, people want to come clean. There's other things that are short of, so that's.
I just meant this, that didn't sound like a whole lot. I mean, and that was my question. If it's almost, if that's what you're saying is the amount of uncollected debt that this bill deals with is only $7,000 a hospital?
No, go on, Marceline, I'm sorry.
They did a study looking at all of the looking based on the past, how much debt is about $1,000 or less, 944 or less, and assuming that 5% of people wouldn't pay if there were no lawsuits, and they made other assumptions that 50% of people wouldn't pay if there were no lawsuits, and then calculate out what that would be. And the assumption was, again, $7,000 or so at the low end. And I think, again, if you think about any kind of debt collection, there's a much larger universe of people who get a notice that they have a debt that they owe, that pay that before they go to court. And I think that's the important
Marceline,
thing.
let me just say this. Let's assume that's too low. You look at their methodology, you say this is way too high. Let's say it's $70,000 a hospital, not $7,000.
I think that's the high end.
The question is, would that have any impact on our all-payer model? Let's say they're off by 90%. And I don't see how we don't have that many hospitals. If it's 70,000.
That was my next question. Multiply that by the amount of hospitals. What are we talking about?
Well, I don't know how many hundreds of millions of dollars in our system, but the idea that 70 grand, so let's assume they're off by 90%. But even that, I thought that we would have a year later an analysis by MHA to quantify. That was the reason we didn't move the bill last year, because I was under the impression there would be an actual analysis done. That the reason the BU guys were brought in, because the easy thing was to sort of sit on it and come in and just cite yet again the all-payer model, which is the testimony from last year. So, now we're in the middle of a pandemic and you just cite the all-payer model without any analysis, a theoretical impact in the all-payer model. Like that, the burden should be a little higher, I guess is what I would say, a year later, to just cite the all-payer model and nothing more. So I don't want to belabor the point, but that's
okay.
And I would just simply add to that, what I didn't talk about is all the cost for taxpayers if we do nothing. They're saying that if we put a threshold on, you'd protect at least 7,000 people. So you think about what we would spend if these people's wages are garnished, if they lose their home, if they lose all of their savings, they're going to look to public assistance. They're going to look to emergency shelter. They're going to look to these other costs, and that would fall on taxpayers as well. And the cost would be much more devastating for them to get out of if they lose their home, they lose all the money in their bank account, they lose their wages, than the cost is to the hospital.
Yeah, like I said, I'm not sure I agree with the means of collecting the debt, but it just surprised me when I heard the amount, and that's all I wanted to clarify. So thank you very much.
Thank you, Senator Hershey.
Senator.
Thank you so much. Okay, did any of our other colleagues have any questions for Ms. White? Okay. If not, we'll move on to the next witness, who is Ashley Esposito.
Good afternoon, Madam Chair. My name is Ashley Esposito. I'm a Baltimore City resident and proud mom, and I have medical debt. I support the Medical Debt Protection Act because as new parents to a miracle baby in the middle of a pandemic, isolated from support and doing our best, our largest stressor is the dark cloud of medical debt that we have from our hospital. My family probably has some of the best insurance in the state, and we still have medical debt due to copays that were billed funny from OBGYN, IVF, and specialist care. This was due to a hospital billing issue. Our hospital told us that our balance was $0, and it's not rare, or it's normal for us to not have copays at certain visits. We were told we didn't have copays at our appointments, and the hospital passed our debt off to a collection agency who calls me multiple times a day, threatening to take action, like taking me to court or damaging my credit score. And it's psychologically damaging to have these phone calls treat me like I'm a bad person for seeking medical treatment. Our opponents make the false claims that these would prevent lawsuits or allow hospitals to collect the debts, but that's not true. I can't afford to pay my debt off in full, but SB 514 would require income-based repayment plans, cap on interest rates, and it would make it easier for families like mine to pay off their medical debt and prevent us from losing our homes, wages, and sanity. SB 514 will ensure that families like mine are treated fairly. It shouldn't be the patient's responsibility to deal with predatory medical debt practices while we're supposed to be healing. People are way more important than profits. I urge communities to vote yes on this bill with no weakening amendments.
Ms. Esposito, any questions for this witness?
Mr. Chair.
Senator Hayes.
I just wanted to mention, Mr. Chair, not only is Ms. Esposito a resident in Baltimore City, but also a resident of 40th District and a very outstanding community leader in our district. And so welcome, Ashley, to the committee. And Mr. Vice Chair, I sent a message over to our staff to sign on as a co-sponsor of this legislation due to Ashley's advocacy on this particular piece of legislation.
Thank you, Senator Hayes. Any other questions?
Thank you so much.
Any questions from any other members of the committee for this witness? All right, seeing none, we will move to the next witness, Richard Alexander. You have 2.5 minutes.
Chair Kelly and members of the committee, thank you for the opportunity to speak today. My name is Richard Alexander, and I'm a registered working nurse in orthopedic trauma unit at an acute care hospital. I'm a resident of Montgomery County and a proud member of the National Nurses United. At the bedside, I work every day to help patients heal from traumatic injuries. Other nurses and caregivers at my hospital, we put our patients first. Our patients should be focused on healing from trauma, not worried about medical debt or the hospital suing them to collect the debt. Patients who postpone necessary care because of financial worry can get worse. COVID-19 pandemic has really driven this home, and understanding that avoiding care can put lives at risk and lead to the spread of disease. We have a crisis in our state. Over a 10-year period ending in 2018, more than 145,000 Marylanders were sued by hospitals for medical debt. Each of you have hundreds or even thousands of constituents who may be a target of such suits. And many of those constituents face financial ruin, losing their home, or having their wages garnished. Lawsuits are only a small fraction of 1% of hospital revenue. Medical debt lawsuits are not important to the hospital's bottom line, but they can be devastating to patients. Maryland patients need this committee to ensure that hospitals not only provide quality care that Marylanders rely on, but do so with compassion. This bill will expand consumer protections for medical debt collections to protect patients by prohibiting the hospitals from placing a lien on a patient's home, stopping hospitals from garnishing wages to collect medical debt if a patient is uninsured or qualifies for free or reduced care, requiring hospitals to offer monthly payments to patients with fair interest rates so they can reasonably pay back their medical debt, prohibiting hospitals from suing patients over debts of less than $1,000. Nurses and other caregivers across the state are dedicated to provide quality care to all of our patients. It is vital that our hospitals reflect the values of the people of our state and do not put the welfare of our patients at risk. This bill is an important step to protect Marylanders. Please pass this measure with a strong patient protection provision intact. Thank you for your consideration.
Thank you, Mr. Alexander. Are there any questions for this witness? Okay, Seeing none from the committee, we'll next hear from Donna Edwards. You have 2.5 minutes.
Good afternoon. I started my day with some of the people from the Finance Committee, so it's good to see you again. Thank you, Mr. Vice Chair. An excellent job setting this bill up, and thank this committee for the work that you did last year and moving it again this year. The AFL-CIO, Maryland State and DC AFL-CIO, we've been a major part of this whole procedure over the last couple of years and pushing for protections for workers and individuals who are having their wages garnished, their home liens put on their homes. And we were part of the study that Vice Chair Feldman actually pointed out. Maryland's not-for-profit hospitals recorded $5.6 billion in profits over the 10-year period from 2009 to 2018, while demanding the payment of almost $269 million in medical debt, and that was a mere 5% of their profits. In the same time, report after report showed hospitals leaving 21 million, 17 million, 19 million for just one hospital in charity care that they did not spend year to year while they were still garnishing the wages, putting liens on people's homes. So this is not frivolous spending. It's not taking on new credit for luxury items. These are medical needs that must be met. They affect all of us, and no one is immune from unforeseen medical emergency or procedure. Wage garnishment for debt forces workers into a difficult position of having to decide between paying for household bills or getting necessary treatment to live, and it starts a downward spiral. So Maryland's hospitals clearly have the resources available to stop the practice of wage garnishment. You all actually enhance the charity care that they are getting last year. They can provide the same level of care for everyone while simultaneously avoiding enacting financial harm on lower wage workers struggling to survive. So we do ask for you to give a favorable report to Senate Bill 514. And I thank you for all the work that you have done on this issue.
Thank you, Donna Edwards. Are there any questions for the witness? Okay, seeing no questions for the witness, we do have this is an unfavorable witness, Jennifer Whitten. 2.5 minutes.
Thank you, Mr. Chairman and committee members. For the record, Jennifer Whitten here representing the Maryland Hospital Association and our 60-member hospitals in respectful opposition of Senate Bill 514. You know, Maryland hospitals, we would agree with you, are committed to ensuring people receive medical care without financial worry or hardship. And I'm pleased to hear many of you speak to the financial assistance reforms that happened last year. I think it's important to note that there was not additional funding provided for charity care, but what you all did was extend out the federal poverty limits so that somebody who perhaps needed additional financial assistance for free or reduced care could do that. We also extended out notifications and a number of other provisions, and hospitals have been working very hard since this fall. That bill went into place October 1st to implement many of those provisions. I appreciate the sponsor. We did meet several times with him and the House sponsor and the proponents, trying to really come to a compromise and areas of agreement. Some of the things that we've heard today around payment plans and appeal process and many of those things, Maryland hospitals do that today. It was really about some of the technical issues within the bill. There were some areas of concern, of course, that we were unfortunately surprised to see in the final bill before you. And really what it comes down to is this concept of the question of, does this impact the Maryland's model? And I'd point you all to the testimony you received from HSCRC, Maryland Medicaid in particular. So anytime that we increase uncompensated care, that is funding that comes from all Maryland hospitals. That is determined every year through a global budgeting process. And Maryland hospitals all pay into this fund. It's the core tenet of the Maryland model. So we can ensure that every person who needs access to care, regardless of ability to pay, has access to care.
What I think is important for you to note is that just in 2019, so we speak to the report that has been referenced several times, I really have to question some of the data available. Just in 2019, we had $289 million roughly in bad debt reported. And so it's important for you all to think about how we balance that, because as we increase uncompensated care, we make care for all patients in Maryland more expensive. That includes Medicaid patients, and that includes those receiving financial care. So although we wholeheartedly agree that we want to preserve that model, because that is really unique to Maryland. No other state has that approach, as you all know, but we need to make sure that we're preserving that. I heard a lot of testimony today too regarding care that was not covered by their insurance plans. If you really look into the data, what we know, what is really driving medical debt are high deductible health plans, and the out-of-pocket.
Jen,
Yes.
let's try to get to the.
So thank you. So without us really looking at some of those other additional pressures, we're really not getting to the heart of this issue. So appreciate the conversation. We're committed to this, of course, but we would ask for an unfavorable report. Thank you, Mr. Chairman.
Thank you, Jennifer. Yes, Senator Klausmeier has a question. Senator Klausmeier.
Thank you. Jen, I'm just confused about this whole thing. It's because we have uncompensated care, correct? We've had that since I've been here in Annapolis. Is that just for people who don't pay anything?
So Senator, thank you for that question. I appreciate that, and appreciate that you have had some experience helping us evolve with the Maryland model that we have here. So uncompensated care is made up of really two different components. It looks at providing charity care, which you've heard reference, which is really that care for individuals who cannot meet Medicaid and need that support and are unable to pay for their care, or financial assistance for reduced care. So now we have up to 500% federal poverty level. So anyone who meets that threshold would get financial assistance. Then that same uncompensated care fund also covers and helps address some of the bad debt. But this is adjusted every year based on what's reported annually to the HSCRC. So it is funded by the hospitals.
And will this bill affect the uncompensated care, our waiver?
Absolutely.
I'm concerned because I know it took us how long to get that waiver straightened out over the past few years.
That's right, Senator. And we just signed a new agreement with CMMI to extend out this waiver because we have been successful, and it does bring a lot of resources. In fact, the only reason the uncompensated care fund exists is because of that model. So as we drive up those costs, we drive up overall healthcare, and that counts against us from CMS. So again, it's about balance. I think if you look at HSCRC's testimony, they really speak well to this. And so does the Medicaid department as well.
And you know, I feel for Ashley Esposito when she said that they keep calling her, you know, the debt collectors call. Now, isn't there some way we can put a curve on that and that she could pay a little bit each month or something like that?
Absolutely, Senator. So currently how it works, and maybe if I might just answer this question a little bit for process, is that an individual, after they are discharged from the hospital, they'll receive their first bill from the hospital. Then they will receive 4 bills. And at any point within 240 days, an individual can say, listen, I can't afford to pay this debt. I need either a payment plan or financial assistance. Perhaps they're eligible for Medicaid. The hospital will work with that individual at any point. And if their circumstance change, then they can reapply for a new plan. What we're talking about is after there's been a determination on a payment plan, financial assistance, Medicaid eligibility, then we go into the billing collection. Again, an individual has up to 240 days to make sure if there's any changes in their circumstances that they can make those modifications. And I think that that's just really important because we do want to make sure that's our incentive, is that if anyone needs that support, that we can do that. It's also important to note that Maryland is the only state that does not allow Maryland hospitals to sell their debt. So unlike any other state, they allow for-profit other hospitals to sell the debt, which then debt collectors can increase by percentages and other additional fees. We are prohibited in Maryland in doing that.
Okay, now the last question I have is, have you been working with like Marceline and any of the other folks? I mean, the hospital?
Yes, Senator, we met with the proponent several times over the interim. We actually worked on significant language. I personally spent several hours with my colleagues right before the holiday and working through technical amendments. We also offered many consumer protection language, but did identify areas in terms of thresholds. I think it's important the bill not only includes thresholds on legal action, but also thresholds on collection activity. So it prohibits hospitals for collection activity less than $1,000, amongst many of the other provisions. And we just couldn't get to an agreement on that.
You did have an agreement on all this?
We did not. We did not get to an agreement, unfortunately.
So there's no compromise here, or? And the other reason I'm saying that all day long, the good chairwoman kept saying on even tiny bills, you got to work together and you got to get together and do things to, so that's my advice, to get together and work on this. And I know I know you guys want a clean bill, but there's two sides to every story. So that's every issue. So
appreciate that.
Thank you. Thank you, Senator Kosmeyer. Thank you.
I'm finished.
Thank you. Chair Kelly, we have questions from both Senator Hershey and then Senator Bidle.
Also Senator Feldman.
Yeah, go ahead.
Okay. Senator Hershey.
Thank you very much. Jen, one of the last things that you were saying in your testimony was where this debt was coming from. And you said, I don't know if you said a percentage or what it was, about coming from high deductible health plans. Is that right? So these are people that have insurance, but their deductibles are due, and they're due to the hospitals. Is that what you're saying?
No, thank you, Senator. And let me clarify that. So there's a lot of national research, and although I may not agree with many of the points within the Economist report submitted in the testimony, they actually do note that what's really driving medical debt are these high deductible health plans and the out-of-pocket deductible. So we find ourselves now, you purchase insurance, you think that you've got that coverage, and then all of a sudden you're receiving a bill for, $4,000 because that's your deductible. So what we're finding is we need to really do more around literacy. We need to do more around affordability, because that's really where I think folks are getting stuck. And I think it's important to note that even if you have insurance, you can still apply for financial assistance. That does not preclude you from applying for financial assistance. And it is a big issue, and it's something we really need to look at, because we're seeing those trends increase even here in Maryland.
All right. And then one of the things that has been mentioned over and over again is about wage garnishment and liens on property. Those are only implemented through the legal system, right? I mean, that is the result of a legal procedure or a court hearing. Is that right?
That's my understanding. Yes.
Okay.
And there's certain provisions around that. I don't know all the details, but yes, that's correct.
Okay. And so the HSCRC says that you have to make a good faith effort in collecting debt. But I guess the decision to actually file legal suit is that on a hospital by hospital basis? Is that who's deciding that?
So So Senator, it's a good question, and I don't know the very specifics, but the hospitals do work with collection agencies, and they do at the last resort, if there is a lawsuit filed and that's determined, by the attorneys, then they will seek that action. But again, that is the last resort. I mean, hospitals have every incentive to get individuals in payment plans or covered under Medicaid or financial assistance.
And last question, you mentioned hospitals cannot sell their debt.
Correct.
And maybe this is a question for the proponents. I'm just wondering, what is a better avenue maybe from the patient's perspective of, just you guys selling the debt and having debt collectors call somebody all the time, or legal action. But it kind of appears that that's the sticking point of where we are right now is kind of when it goes to legal action and the garnishing of wages and the liens, I think is what appears to be a little bit overbearing to the collection methods, I guess. So.
Thank
All right,
you,
that's
Senator
enough.
Hershey.
Yeah, thanks you.
Yeah.
Thanks.
Thank you, Senator Hershey. Senator Bidel, followed by, I believe it was Vice Chair Feldman and Senator Hayes.
Thank you, Senator Augustine. I'm going to change the conversation just a little bit if I can, Janet. Thank you for your testimony, and I understand the balance that we're always working in with the waiver. But I have a family member that's seriously ill, and a lot of the problems they have with billing is it's not coded properly, and the insurance doesn't pay something because it either didn't have pre-approval or it wasn't coded properly. And my sister that handles the billing is excellent, but a lot of people don't have someone like that who will just keep going after the insurance company and the hospital and the doctor till they get the coding correct. Is someone helping these families? That could be part of the issue with the big bills.
Yeah, Senator, I appreciate that question. And it's unfortunate that the committee was not able to attend. We did a briefing for HGO in the fall, and we actually had one of the agencies that we work with, Ms. Godley Davis, and she really talked about the resources and outreach and really working with patients and families and identifying and working with them. So many hospitals do partner with those kind of agencies. I'm happy to follow up with the committee with some of those resources where we can share about the ways that they reach out, because we do know it's complex. In fact, we would really like to look at how we do the billing system, because unfortunately we put providers as the bill collectors, and that's not really the position we want to be in. And understand, even in the bill before you, there's a section related to appeals process. We think there's some technical issues there, but conceptually, I think it's a great idea that we should have insurance companies notifying hospitals when there's an appeals process or a redetermination, because that's all on the onus of the patient or the family at this point, and they don't always know that's happening. But that's not what was included in the bill. So those are the kinds of things we would support if given the opportunity.
Thank you.
Thank you, Senator Bidel. Vice Chair Feldman.
Thank you, Senator Augustine. Okay, so Jen, just a couple of things. I'm glad Senator Hershey, did get some clarification, because you talked about high cost deductibles, which has nothing to do with medical debt collection activity. I mean, that really you kind of conflated the two conveniently, but they really have nothing to do with this bill. But Senator Hershey's point about hospital by hospital practices, I thought you've indicated, because we have met about this, and I don't want to misrepresent anything in the committee, but 1/3 of the hospitals don't file lawsuits. Is that so? Each hospital absolutely has decided there are models other than lawsuits to get their debt. At least 1/3 of your membership are not going that route, but I don't want to represent that. Is that not the case?
So, Mr. Vice Chair, thank you for that question. So the majority of Maryland hospitals do want to retain the ability to file legal action. It's really not the legal action, but at times it's being able to submit that letter to say, we need you to respond and work with us. You're correct that there's about 1/3 of Maryland hospitals that do not use that, but I'd note that those hospitals mostly serve individuals who qualify for Medicaid. And so therefore there is no collection on Medicaid patients, as you all know.
And just two things. Again, I think, I want to get the committee. So last year when we had this discussion, we did pass the financials. And of course, you brought up the all-payer model. And it really was my sense that you all were going to do some kind of an analysis. I mean, you mentioned HCRC review. I mean, all Katie does in here says they don't have enough information to evaluate the impact on uncompensated care. That's her conclusion. So what happened to the analysis from a year ago that I thought we would have to be able to have this discussion this year, which is the only reason we didn't push the bill last year? I thought you all were going to do some analysis about this or get somebody to do an analysis.
So Senator, thank you for that question. It's a good question. HSCRC was asked by both you and the House sponsor and the House chair of HGO to look at an analysis. And what they concluded is, at this time, it's hard to make that determination because we can't really predict patients' behavior.
Okay.
Even in the economist's report that you have before you, there is a statement to say that it is likely that if you put thresholds on collection and legal action, patients are likely not likely to pay their bill. We don't know what that results in.
Okay. I just want to get that out there that last year the opposition was entirely the boogeyman of the all-payer, and then let's do an analysis. And then a year later, we couldn't do the analysis because it's too hard to get, I'm just trying to kind of get to, and I guess then finally, Jen, I mean, you list a bunch of stuff that you think is actually very reasonable in the bill. You say a lot of the practices that I outlined that are in the bill about, holding are actually fine. So I was hoping that you would come in with a favorable amendment saying there's stuff about the bill we don't like, but boy, there's 8 things in this bill that seem entirely reasonable in terms of guardrails. I know the advocates want a clean bill. So what made you decide to just come in all blown opposition, all payer model, as opposed to maybe 6 or 7 things that are in the bill that I think you would concede are actually perfectly reasonable guardrails to maybe put in place?
So thank you, Senator Feldman, for that question. Again, we worked diligently with the proponents over the interim. We were very clear from the get-go that I'll be very transparent with the committee that we could not support thresholds on collection and legal action, again, for the reasons we discussed today. And some of the other provisions, we did offer, language and work through other areas. However, the proponents wanted to proceed forward with a bill that had the things in that we were clearly opposed to.
But right now the bill's in the committee. Like, it's not about proponents and opponents. It's like in the possession of the Health and Government Operations Committee and the Finance Committee. And so I'm just, saying that, okay, I'll just leave it at that. I just want to make the point. It's, once you get to the hearing stage, it's the committee that possesses the bill, right? That's like how it works down here. It's not about proponents, opponents. It's about what the committee's going to do with the bill. So I'm still hoping that there could be conversations with Delegate Cullison and HGO and this committee, and I'm still hopeful we can do something this session and that's meaningful, not watered down to a point of doing nothing either. But I appreciate it. And let me just say, for the sake of the committee, the Maryland Hospital Association did meet several times. And they weren't, evasive, and I want to commend you for that. I just want to say that. So,
thank you, Vice Chair Feldman.
Yes, Chair.
All right, Senator Hayes.
Thank you, Senator Augustine. Jen, I'm not sure if other people noticed it, but it definitely went unnoticed. It went noticed by me, and as the young people around the way would say, you threw some low-key shade at Senate Finance Committee for not attending the briefing that HGO was invited to. So hopefully we get another opportunity to go to that briefing to learn about coding. But my question is, you noted that most of the debt is as a result of the deductibles. I would imagine there's in some plans, or there's some situations where there aren't deductibles. In those cases, what do you think what are other factors that are contributing to some of the medical debt that individuals might accumulate?
So, Senator, thank you for the question. And first, I did not mean to presume or sound disrespectful. In fact, I really do hope that I'm able to share the information that we were able to share in the fall, because there's some good information about many of the practices and current state and federal laws. So I just want to be very open for us to provide that information to you all, and know that your schedules are very busy, and appreciate your time. In terms of other competing factors on medical debt, I mean, we would agree, you know, there are a number of considerations right now during COVID. We anticipate that several people will be losing their insurance coverage and their job status will be changing. And again, that's why it's so important for us to preserve our uncompensated care model and our approach, so that we've got that financial assistance really available to anyone who's seeking care. Now, we're only speaking to the care delivered in hospitals. This doesn't really address any of the care outside of hospitals, but it is our goal to make sure that we continue to maintain that, so we have charity care. And so we want to work with each individual. And at any point, I hope anyone listening to this hearing today knows that if they're struggling with this debt, that they can contact their hospital and work out whatever payment plan based on their unique circumstance, regardless if their circumstances are changing daily. They have that availability to do that.
So you raise an important note, and given like these economic times with, you know, dealing with the pandemic and other things, in the case where people may have had difficulties given the current situation, is there anything that the hospitals could do? And I'm guess that's what you're recommending, contact the hospital to see if there's any accommodations. But is there anything across the board that hospitals can do or are doing to mitigate some of the difficulties that families may be facing during this time with medical debt?
Absolutely, Senator. I mean, one of the first, you know, throughout the process when anyone is seeking care, whether it's scheduled or during an emergency situation, one of the first things that we do is to make sure they know financial assistance available. And we want to enroll folks, you know, in programs. I expect that we'll see an increase in Medicaid and the need for additional financial assistance. And so that's going to be very important that individuals are not fearful to say, you know, I need to work on that option. I need support to make sure that I can have this bill dealt with. And so, you know, working with our community members, working with our partners, working with other agencies to do that outreach is really critical.
Thank you, Senator Augustine.
I'm going to butt in and suggest that officially we bring the hearing to a close, and we can continue offline to share. Okay, and colleagues, I'm understanding that we will find out by tomorrow probably that we're going to be having some double sessions and more sessions more days next week. So stay tuned. Okay, and so this will end our official hearing, and if you want to continue to talk, you may. Thanks so much, and thank you, Senator Augustine.